I think, are we live?
We are live, sir.
Okay.
I
Okay,
think, are we
so
live?
We are live, sir.
okay. So good evening
Gaurang,
and
I'm audible?
yes, sir.
I'm
Yes, sir.
okay.
Okay. I will just introduce a little bit, and sir, I will invite you in next 2 minutes.
Sure.
Okay. So hello everyone, and welcome to today's homeopathic marathon masterclass with the best homeopaths in the country. Few of the best homeopaths from different parts of India, talking about different approaches, uh, talking about how they are handling cases, how they are handling difficult pathological cases, and it's a very special day today. I'm also going to launch my book, The Art of Repertorisation, towards the end. So it's a very special day, and the speakers and the teachers, these are all people who are my teachers. The first person on today's talk is Dr. Subhas Singh. I don't have to introduce him, a legendary homeopath of the country, and my teacher, one of the first person who introduced me to homeopathy and introduced me to keynotes and Kolkata approach, and a father-like figure for me, a very important part of my life. Without too much of more introduction, I would really like to invite Dr. Subhas Singh on stage, on the webinar platform, to talk about his approach and just introduce how he manages his cases, and how he is totally helping patients with homeopathy. So please welcome, sir. Thank you so much for joining us. We have participants all across the world who are listening to us right now. So your audio, you need to open the audio, sir. Your audio is yeah,
Yeah.
perfect,
Thank
perfect.
you very much, Dr. Gaurang. It is
Thank
a
you, sir.
pleasure and an honor to be associated with you.
Sir, sir.
I have been witnessed and I've seen you growing up. I am so proud of you.
Thank you.
And I have seen the information about the book, and I am sure it will be well accepted by the profession. And as your lectures are well appreciated, your books will also be well appreciated. Thank you so much. Thank you so much, Gaurang.
Thank you for your
Let
blessings,
me
sir.
let me share my screen.
Sure, sir. Please share your screen. I will go offline so that you can share it totally.
The slide is visible.
Yes, sir. Screen is visible.
Okay, fine. So the topic that we are going to discuss today is approach to difficult cases. What I do when I face any difficult case. Well, to be very honest, for not only a difficult case, because every case is difficult for me, and whenever a new case comes to me, the question for me is where to start and how to approach. And this is one of the challenging questions when encountering any case. Every new case we take is a new world we enter. The usual thing for every case that we do is we take up the history, and then after that we make a portrait of the disease, followed by remedy selection on the basis of totality. And if we are getting any striking, uncommon, or peculiar as described in aphorism 153, then we feel lucky, because in every case we don't get it, and the problem arises when we don't get it. And then cure of the case. And if all these things do not happen, then the zigzag direction of cure has to be taken. And since we are discussing difficult cases, so this is the zigzag route that we have to approach. That is what is the point of discussion today. So you see, there are many conditions in which case can be difficult. It can be, for example, I am coming one by one. For example, we can have a situation where we don't get enough symptoms. There are lack of symptoms. And this lack of symptom or paucity of symptoms can be because of many reasons. One of the reasons can be our failure to get the proper symptoms. We are not discussing this. Where, in spite of our best effort, we are not able to get enough symptom, that is the point of discussion. Or there can be too much of symptom, maze of symptoms. Well, where we are getting not enough symptoms, that can arise due to one-sided nature of the disease. The disease by itself is one-sided. Or where there is a gross pathological changes. Or there is sudden acute emergencies and not enough manifestation. There is not enough time for manifestation to get the individualizing features which we always search for and which is important and which is the basis on which we select the medicine. Suppose when we get one-sided disease, then what is needed to be done is very well defined in organ. What is available, that has to be made the basis. One or two symptoms that we get one-sided, we know, are basically chronic in nature. So whatever symptoms we get, we make that as the basis, and on that we prescribe. And in acute emergency, that is a totally different ball game. We are not discussing that. But suppose where there is a gross pathological change. Now, where the gross pathological changes has occurred, and the whole disease condition has now crossed the functional level, and the vital force has lost its capacity to react. Secondary curative response can't be expected. So whatever we are getting are only the symptoms of the disease. That can be one condition. In certain, as I was saying, in certain acute emergencies, here the stimulation of vital force is either impossible or the vital force has lost the reactive power, like asphyxia, problem, any accidental condition. In such cases, it is very specifically mentioned that you have to go through the antipathic, or as we usually tackle the emergency condition, not necessarily, because the important thing is to save the life of the patient, and there you do not get enough time for vital force to react. So you have to take help of other system of medicine. Now, where there are too many symptoms, maze of symptoms, conditions where the patient presents a lot of symptoms, and basically the reasons are patients sometimes are hypochondriacal. Hypochondriacal, we all know, are the condition where there are too much of sensitivity, oversensitivity. This hypochondriacalness, the person sometimes exaggerate the condition, not knowingly that he is exaggerating. Where he is knowingly exaggerating the situation, that is, he is feigning. Those are feigners. So a physician, we all know the physician need to have certain qualities. And these are the qualities which help us to differentiate whether the patient is hypochondriacal or he is feigner. And accordingly, we will differentiate and approach the condition. So for individualization, the basic aim, the basic purpose, and our basic goal in every case, whether it is a simple routine case of cold and cough or it is a very difficult case of where the patient is manifesting symptoms of cold and cough, but he is suffering for now is the time when the patient is having COVID positive. There also you have to individualize ultimately, because without individualizing you cannot go ahead and treat the patient. We have to take help of anamnesis. Anamnesis is most important holistic approach. Diagnosis of the patient, that means the homeopathic diagnosis. I'm not talking of nosological diagnosis. Here, in-depth individualization need to be done. And anamnesis can be done at any stage of the condition. Even if it is advanced stage, we take help of, which we are going to discuss, we take help of other methods, other means, other information that is available, and ultimately individualize and anamnesize the patient. Dr. Patel has said that an anamnesis without mental or general symptom resembles a rider-less horse. So these mental or general symptoms has to be there, even in the most difficult cases, even in so-called incurable cases. That is why case taking has been called an art, where you have to use all the techniques that is available with you and ultimately differentiate the feature that the patient is manifesting so that you can get the inner core of the patient's illness. That is very important, and for that the physician has to be very well trained. The physician has to have all the qualities that is described in our. Sometimes when the present is not enough to individualize, the present is not enough to know the disease in homeopathic sense, then we have to trace back, we have to trace trace the path of the disease, the illness, and go to the past and see how the disease, not really in the sense of pathology, but disease as in dynamic sense, how it has evolved. Sometimes this past may go back to the family history to trace out, because even if there is advanced pathology, we will definitely get some information in the past history, some information in the family history. And one has to trace out and correlate with the present disease condition. There, one has to apply the linear method, and this linear method between the cause and the effect. There has to be some method in the past which is manifesting itself in the present. That need to be understood, and that a physician has to find out. There is another tool where we are not getting enough symptoms or where the case is apparently incurable. The last appearing symptoms. This is if we are able to properly get the complete picture of the disease and we are able to find out the last appearing symptoms, then that helps a lot. Ranking close behind or even at times taking precedence of the peculiar and general symptom must be placed the last appearing symptom of the case. These symptoms, to be of any real importance, must of course be outstanding and definite, and if so, they are always of the first importance in the choice of the remedy. The basic rule: we should not be overwhelmed by the diagnosis or the severity of the case. The basic rule has to be kept in mind that we treat the person, not the disease. Now, there are certain conditions Kent has described in his first observation only, where there is a prolonged aggravation and final decline of the patient. This happens after giving the medicine. So you have given a medicine because you have been able to individualize. Now here comes the art that we are getting symptoms, but those symptoms are of the disease, because the pathology has so advanced that this is the symptom of the disease, and this has become our basis for prescription. So here we have to learn the lesson from this, that in such condition we should not neglect the pathology. We have to also, when we are taking case, when we are getting all the information of the patient, one should not totally neglect the pathological condition. We have to understand that by pathology only we can know that whether it has reached a condition, it is reversible or it is irreversible. If it has reached to a stage where it is irreversible, then on the symptoms what is available, we give a medicine, and we think wrongly that the medicine that we have given is a very good medicine because most of the symptoms are similar to it. And there we make the mistake of giving the medicine, as Kent has described, in higher potency. And when it is given, a prolonged aggravation and final decline of the patient happens, as it happens in the other 2 or 3 observations that we are going to discuss now. So the lesson that has to be learned is, whenever we face such condition and we find that the pathology has advanced, the pathology has gone to a level beyond the functional level, then we have to reduce, we have to lower down the potency. We should not go for very highly dynamized potency. We should lower down so that this observation of the Kent, the first observation, can be avoided. The same goes for seventh, a full-time amelioration of symptoms, yet no special relief to the patient. The symptoms are ameliorated, yet the patient, the individuality of the patient's well-being, the general well-being is not better. This again can occur where there is a stage, there is the condition in the patient which cannot be reversed. By birth, he may be born with certain condition which cannot be reversed, and he has well adapted to the condition, or it can be while he has uh, accumulated those symptoms while growing up. So this differentiation is very important from the physician's point of view. Now, in those cases where, for example, we very often come with cases of uh, cancer. Patient comes when they have tried everything and then they just want to give a try to homeopathy. And there, when the patient comes with a thick file of all the investigation and diagnosis done and whatever the treatment they have taken, and then when we try to take the history, then what we find that it is very difficult to get the any feature which is individualizing in nature. So in such condition, these are the things that has to be relied on. If we have to see that if there is anything of miasmatic nature, any manifestation, because the patient's pathology has advanced, but the patient must be having some desire. The patient may be having some uh, likings or disliking. The patient may be having something in the background, in the past, in the family history, some etiological factors, if it can be traced. The location itself sometimes points, and the nature of the growth, what is the nature, where there is destruction or overgrowth, that also helps a lot. And of course, the constitution. The basic constitution is always there where the patient, whether the patient is in initial phase or whether the patient is in very advanced phase. So these are the points that we cannot afford to forget, whatever the case may be, whatever the stage may be, whatever the diagnosis may be. If the symptoms are not uncommon and peculiar, which is very common in such cases, that is why the cases are difficult. In such cases, we have to take help of these small guidelines which is already there. For example, we have to take help of accessory symptoms of the medicine. Suppose some medicine has been prescribed. I'm saying homeopathic medicine. And then we get some symptom which is produced because of the medicine. And whatever remains of the old symptom, so this new totality has to be formed. Or status morbi. Whatever is available, that becomes our basis. Dr. Boenninghausen has given us a wonderful tool, the concomitants. Now, this concomitant has to be understood in depth because this become a very good tool, a very good basis for prescribing in such cases, especially if the case is of acute in nature. See, the concomitant may not be present when we are searching for concomitant of one particular symptom. If a patient have one symptom and we are trying to see that whether that symptom has any concomitant, that may be difficult. But if we try to think the person as a whole and think all the symptoms that the patient is manifesting as a whole, and then we try to search for the concomitant symptom in the patient as a whole, which may be not related pathologically, but which will help us in individualize the person as a whole, which may not have any pathological relation, any apparent explainable relation with the manifestation. Those are the concomitants which help us and which is usually found. I'm telling you, if we go for it and if we search it properly, there is enough chances. In so many cases, so many difficult cases. See, I am associated at NIH since last 25 years, and there we do not get, in every case, we do not get enough time. we have a OPD, outdoor patient, the daily turnover uh, before Corona, it was more than 2,000. And even during Corona, now it is coming again and it is picking up. So now in last week, the average was 700. So you can understand that those patients has to be treated within a short period of time. So here, in such cases where and there is not enough time, the patient is has to be treated quickly, and at the same time we cannot compromise with the basic principles. There we take help of this doctrine of concomitant. So Boenninghausen's doctrine of concomitant is a reliable guide in acute prescribing. The more removed they are from the sphere of disease, the greater their value. See, causative factor is another important aspect. It is sometimes, if we are lucky, the patient voluntarily tell us that they say, Doctor Sahab, this is the problem, this has happened, and after this, all this manifestation has occurred. There was an incidence of grief, or there was an incidence of suppression of emotion, or suppression of sweat, or anything. And after that, my present condition has developed. But in many cases, we are not so lucky. So one has to search, because the causative factors, and then when you suggest to the patient that this has occurred, is there any relationship with the present complaint, then he will volunteer, because then he gets a clue, and then he can correlate, and then he can understand that this can be a reason. So this causative, assessing the causative factor is very important, especially in acute condition. In chronic, we all know the miasm has to be searched for. But in case of acute condition, if we are able to find the exciting cause, that makes the whole task much easier. The predisposing factors will also have to be considered. In very advanced pathological condition, there is another aspect, there is another mechanism that I have developed without compromising the basis of individualizing, without compromising the basic homeopathic principles. We call it synchronized symptom complex, or SSC. This is nothing different, If I tell you, then you can understand that it is what is possible. One need to be just have open-minded and correlate these. See, for example, if I tell you that I have a patient who is very thirsty and who is very constipated. Now, when I say thirsty, there are so many medicines that may come in your mind, even if you don't take help of repertory. And then if I say thirsty, then this list is now shortened. I have not told you that thirsty is for large quantities of cold water at long interval. Neither I have told you that the patient have constipation, that is dry, burnt, hard stool. But I have just mentioned these two complaints of the patient. And then I tell you that there is a dryness, complete dryness. Now your choice of medicine becomes very easy. So what are these happening is that these three conditions, which are apparently, if you take one by one, thirstiness, dryness, then these symptoms or these complaints are very common, as described, general symptoms as described in aphorism 153. They are of no value. But when they are occurring together in a patient in a synchronized way, then they point to one medicine. So what I'm telling you, that these conditions are occurring together, and that is a meaningful coincidence. So this has to be identified. And this is easier to identify in a patient, whatever may be the stage, whatever may be the pathology, whatever may be the diagnosis. But this is much easier. Almost all cases we find something peculiar in the case, some prominent feature, peculiar combination of symptoms. Even if you don't get symptoms, symptom in the sense that you get location, sensation, modality, concomitant. Even if you don't get that, just combination of complaints that direct the attention to a certain drug. And this group of symptom or complaints are called synchronized symptom complaints, and that becomes the basis for selection of medicine. So present of some prominent symptoms which may seem to be unrelated, but when they're taken together, they express a definitive meaning. These are usually keynotes, but when they're together, you cannot call it a totality because they do not form the totality because they themselves are not very clearly defined. In real homeopathic sense, you can't call them symptoms. But when they are occurring together as complaints, then they point to a mess. There is another concept, that is shadows of remedy. Say for example, if we go for any remedy in the provings, if we see the records of proving, then we find that there are so many varieties and apparently opposite conditions of the complaint present. For example, if we see the proving of pulsatilla, then we find that there are so many places where it is written that the patient has thirst, as well as the patient is thirstless. So these conditions, which in due course of time, because most of us refer to those common books which have used the commonly used symptom of a particular medicine. For example, we do not know that pulsatilla is also thirsty. We do not know that pulsatilla is very mild and yielding, but at the same time, pulsatilla can be somebody who is very obstinate, very headstrong. We know that aurum metallicum is very depressed, sad, gloomy, on the verge of committing suicide. So much of sadness and gloominess is there. But at the same time, the aurum metallicum person can be somebody who is very lively, very active, has zest for life, tries to find out works that the patient wants to do, and he enjoys these works. He wants to keep himself busy. So I am telling you, these are the symptoms which are unknown because of the books that we read, because of the way we teach, because of the way we study, and that is the shadow of everything. So every medicine starting from A to Z have some symptoms which are less used. And these are, if we are aware of that, then that is something which makes the whole prescription much easier. So shadow is the unknown and unaccepted side of an individual. The shadow is formed due to rejecting and ignoring some aspects of our personality. Same goes for remedy. Then, when the patient comes, we see the end result. We forget that we have to observe the changes all along the line of progress. To know the disease at its beginning, its earlier manifestation, its later symptoms, and its ending. The whole, starting from the point, the whole phenomena of the disease condition in that patient has to be understood. Every medicine has these four aspects which need to be made similar with the disease condition. Just matching the symptom of the patient with that of a medicine, that is not similar. That can be similar, but that is a similar in a very crude sense. We have to think of the pace which symptoms manifest. If we go to our Mathematica, then we find that there are medicines where it is written that symptoms develop very slowly. And then where there are medicines where it is written that the symptoms comes like a turmoil. And then the depth. For example, we have cold and cough in aconite. We have cold and cough in sorinum. But what makes the difference is the depth in which they affect the person. The intensity. A person can have pain in abdomen, but a person can have pain in abdomen. The intensity makes a difference. And the sequence. Say, for example, a patient has 5 symptoms. So we have to understand the sequence in which these 5 symptoms has developed. And then we have to find out a medicine in which these 5 symptoms has appeared in the same sequence. Just matching these 5 symptoms with the 5 symptoms of the medicine is not enough. So pace, depth, intensity, and sequence, that of the patient, where the shortcut methods, these fail, then we have to go in in-depth study of the case. And when we are going in in-depth study, then these aspects has to be understood. These aspects has to be taken care. So a patient's appearance of the symptom, the pace, the depth, the intensity, and the sequence, that has to be analyzed. So case taking in such cases where we don't think of a medicine does not come readily. So in such cases, these are the different points that has to be properly taken care of. How does a patient feels in general from the overall impression of patient from the outside? The general feeling, because that sometimes denotes, even if the pathology may not be found, but that denotes how much the patient has been affected. I remember the symptom of psorinum. We all know that there is no pathology in spite of best investigation and everything, but the patient, general condition of the patient is not well, or degree of energy being affected, as well as any change in ability of the patient to cope with various stresses of life. We all have stress in life, but the energy the patient was having, and now the change that has occurred in the past and in the present, any change in the physical chief complaint as to the pattern of the change. The patient was having loss of appetite, which in itself is not enough for saying finding out the medicine. But the earlier loss of appetite, say uh, 2 months back, that loss of appetite was like, I don't feel like eating, but I have to eat. But now this loss of appetite has become more pronounced. And the pattern has changed. There is a particular time, or there is a particular type of food, or there is a particular atmosphere in which he doesn't feel like it. So these are the changes that help in finer individualization when we face any difficult case. Changes in the character, intensity, frequency of all other symptoms compared in the state study. Changes occur in the mental and emotional way. Even they may be very insignificant, but if there is any change that we find, then that has to be evaluated. In the demeanor of the case of the patient, and that is manifested through his gesture, the posture, and the behavior. See, it is not important that we have to understand the movement of the symptoms only after giving the medicine. But when we are getting a case, at that time also, when we are taking or tracing how the symptoms have appeared, what was the root of movement of the symptoms since the patient has first started to suffer and to the present condition, that also tells us many things. So we have to analyze appearance of new symptoms in recent time or any other old symptoms. Don't think that I am talking about after giving medicine. These can also be basis for giving medicine and understanding the disease condition. More important, any change in direction has appeared, or has there been any lateral shifting, or from general, particular, or objective or subjective, is there any movement of the symptom in these aspects? These also need to be analyzed. If nothing else, then we also have to, because we cannot forget causa occasionalis. There are so many factors mentioned in accessory circumstances that can be responsible for maintaining the disease. So, if there is a recent change in patient circumstance in which he is living, that need to be also analyzed and to be seen if there is anything in it which can suggest a medicine, which can suggest or which can help us in analyzing the patient's condition. Changes in the energy level that we have discussed. And then on the basis, when we are thinking of giving a medicine, we are coming to a totality. Then we have to assess the prognosis. And this can be done on the basis of science of commencement of improvement, Herring's law and Kent's 12 observation. Lastly, I like to say that homeopathy is a very good system of treatment. That does not mean that homeopathy can cure all conditions. A good physician is one who knows and is aware of his limitation. And definitely he should put his best effort to overcome his limitation. But it will be very blind of us to think that we don't have any limitation. Homeopathy also has its limitation. So when treating, because we are deciding the fate of a patient, the life of the patient is in our hand, especially when we are thinking of very acute condition, very advanced condition, very difficult condition. So we cannot afford to make any mistake. So in such condition, we have to think of these and we have to try our level best to overcome. This is the time I have for today. I know this is a very typical topic and it's very difficult to summarize the whole approach of a difficult case. But then I think at least I have put an effort and it will be my honor if I have been of any help to the listeners and audience. Gaurang, thank you very much for giving me this opportunity to share with all of you. Thank you so much, Gaurang. Dr. Gaurang?
Yes, sir. Sir, he's
Yeah.
coming.
Yes, sir.
Have I finished earlier, Gaurang?
That's okay, sir. That's okay. So we want to really thank you. There are a few questions. Will you answer just a couple of questions
Sure,
that some
sure,
of
sure.
the participants have
Sure.
asked? So
Yeah.
one of their questions that they have sent is, can you prescribe based on one very very peculiar symptom? Can you give one example from your practice? That's one question that they have requested.
Based on one peculiar
One
symptom.
very peculiar symptom in the case, like
I
in your.
can do that. I can prescribe, but that will not be homeopathy.
Okay.
Homeopathy do not mean prescribing on one single symptom.
Right.
Even if there is one single symptom and peculiar symptom, that only means there are other symptoms which I have failed to notice.
Okay.
Whether it is keynote method or whether it is any system, any treatment,
Absolutely.
prescribing on one symptom is antipathy, symptomatic treatment. We do not prescribe on symptom, we prescribe on totality of symptom.
Absolutely. Very interesting. And one more question that there is from from few of the participants who are writing on the YouTube channel is, sir, at this moment or when you are practicing in your life, how much time do you dedicate to studying homeopathy, and what do you study in today's times in homeopathy? Means how do you manage your studies time? Do you keep browsing, studying the Organon or Allen's keynote? How often? Or any other literature? How often? What are you studying nowadays, and how are you kind of evolving yourself?
Dr. Gaurang, as you are aware that recently I got an administrative responsibility
Yes,
becoming the director of National Institute of Homeopathy. So that
absolutely.
has reduced my study time to a great extent. And luckily, I have around 500 to 700 teachers in my institute. And I take help of their expertise. Students and patients are the best teacher. And in earlier stage, we read aconite, we read organon aphorism, we read rubrics. Then when you start practicing, then you read that part of aconite which you can't remember when the patient is coming, and you think, yeah, it can be aconite. Or you are confused that yeah, organon may have, but where it is, I'm not sure. So you search for it. Or you ask your teachers or students. So this is how we keep on learning. But having said that, I still read and I find time daily at least to do two, three things. One, I try to keep myself abreast, updated about what is happening in the different fields. Suppose when Gaurang publishes a case or he discusses a case, then I make it a point to read it to understand what he's doing, how he's being successful or how he's being a failure. And similarly, the journals, the different, we have so many platforms where we can get this
Sure.
information. And Materia Medica is something, if you don't read it regularly, then you forget. So either you read through a book or you discuss with somebody. We are always making a point to regularly do that. That is how you keep yourself fresh. You keep yourself updated. So I daily find myself, at least, if not in institute, then after I come home, at least some time where I can devote some time to study, because without that, I have no identity. I came in homeopathy for this particular purpose. So I do read, and this is how I keep myself updated.
Fantastic, fantastic. One last question from the participants, which I'm going to ask, and this is a general message for everyone from you, sir. What is the secret of success? What would be the secret of success you would give to our participants who are students from all across India? Not everyone is lucky enough to study under you, but there are many, many colleges students all across the world. What is the secret of success? What would you tell students, interns who are studying everywhere, who are watching this right now?
Dr. Gaurang, at the risk of being repetitive, because I may have said it at different platform, because the truth remains same.
Fair enough.
My formula is very simple. I don't believe that homeopathy needs much intelligence in order to be practicing or to be successful. If you don't believe, look at me. I'm not intelligent. Look around your teachers in any institute.
You're just being
We
very
are we are not intelligent. We don't need intelligent people in homeopathy. We need a person who believe in it. We need person who are sincere, who are dedicated. Once you have fixed up a goal, so whatever route and whatever, whether you liked homeopathy or you got second chance or third chance, but when you came to homeopathy, this became your lifeline. This became your identity. This became your everything. So once you have find love in homeopathy, then you will find out your own way. We all have found our own way. Success comes from those who reach for it. Don't think that I will see in my dreams, I will think that I want to become successful and next day I will be successful. Successful persons are those who dreams big and then next day they work hard to fulfill that dream. So don't shy away from working hard. Don't shy away from saying proudly at every platform that you are a homeopath. Whatever may be the reason for which you came to homeopathy, but now this is your identity. Be proud of it and think that if others have become successful, if Dr. Gaurang has become successful, if myself has become successful, then you also can become successful. We are not toppers in our institute, but we have reached what we wanted to.
So well said, so well said, so beautifully said. And thank you so much again, sir, for enlightening so many of homeopaths all across the world today. And I'm also very deeply grateful for you to write an introduction to my book. It means a lot. Thank you so much.
My honor, my pleasure.
Thank you,
Thank you,
sir.
Dr. Gaurang. Thank you so much.
Thank you, sir. Thank
Please
you.
permit me to leave. Thank you.
Absolutely, sir. Absolutely.
Thank you.
Was an absolutely amazing session by Dr. Subhas Singh. And we have our next speaker very soon joining us. We have Dr. Pradeep Kumar Gupta, sir. I don't have to introduce him. He is one of the most respected and well-known homeopaths in the country. Here we have Dr. Pradeep Kumar Gupta, sir, and one of the only homeopaths in the country who's really working very hard in homeopathic hospitals and helping many, many patients in the homeopathic hospitals, and a very big inspiration for many, many people all across the world. So it's an absolute pleasure and absolute honor to invite Dr. Pradeep Kumar Gupta, sir, to share about how he solves challenging cases in his practice. He's such an inspiration to us, and so humble, down to earth. Just such a pleasure to know him. Thank you, sir. Thank you so much for joining, sir.
You, Gaurang, call me with your students, friends, and the August gathering. Actually, as you told that I am a down to earth, really I am down to earth. I don't spoke much in the gatherings of like intellectuals because I say homeopathy is a very difficult and very challenging job. It need a humbleness and the humanity. The person until is not humanity attitude can't be a good homeopath. If not humble, cannot be learn anything. So
So much to
the
learn from you. So much to learn from you, sir.
it's my pleasure that you think like that. But I put some things only uh, to my future generation that homeopathy is a system of medicine. It's a very unique system of medicine. It needs lot of attention, lot of care, lot of understanding of the subject, and lastly the application of the knowledge. So once again, thank you very much.
Thank you. Thank you so much for coming here. And I'm going to leave the platform so that you can present your case and also inspire our people here. Thank you so
Uh,
much.
Thank you, Goran. I just quickly share two cases
Sure.
and little bit about myself. This is a hospital, and this is the building whole of the hospital. And this is NABH accredited, everybody knows. NABH is equal to Joint Commission International. We have outdoor training, indoor training, clinical teaching and training, bedside teaching and training, repertory classes, working on real cases, mathematical classes, bedside, organon classes with posology. We cater all medical emergencies only by homeopathy. And today I will see one case whom I discharged today. This is our emergency department. We are fully equipped and modernized to take the emergency patients in our hospital. We have 100 bed capacity, expandable to 200 beds. Some dignitaries who visited our hospital are with me, Professor Dr. Kundu and Dr. Mrs. Kundu, with a patient. My students, PG and interns in the ward, some foreign dignitaries in the ward interacting with the patients. For us, the patient is an extended family. It's a birthday celebration of a grand old man of 85 years who was admitted in our hospital. It is the marriage anniversary celebration of a couple who were admitted. It's a homeopathic child. The mother many times failed the IVF and lastly come to our hospital and she got this beautiful baby. Look the baby.
He wants to come.
Yes, he can. Care of the patient is a homely atmosphere in Neminath. Look, she is the patient and she is celebrating a festival called Karva Chauth in our hospital. Look, these ladies, they are indoor patients, but how feeling they are so homely with us. We have 4 special research projects: diabetes, type 2, thyroid dysfunction, psoriasis, and rheumatology. This is Dr. Ritu with the hypothyroid patients, Dr. Saurabh, Dr. Alpana, Dr. Kranti Kumar. This is our dispensary. We dispense medicine only in water. Physiotherapy as adjuvant to homeopathy. This is dental care. with homeopathy. Yoga is a daily routine. So the meditation, clinical training program for professionals at bedside.
एक बार एक मरीज का हमसे वहाँ पे बनाया था विदेश में देखना
यहाँ से
Slides from So it's a case of acute myocardial infarction. Admitted in this hospital just 6 days ago on 16th February 2021 at 3:30 p.m.
कब से बैठो?
उस दिन दवाई ले गई थी,
हाँ,
लेकिन कुछ खाया नहीं होता है, परसों भी जाते हैं।
अच्छा परेशानी क्या हो रही है वो समझाओ।
पहले मतलब हम दवाई तो लेने आई थी, हालत से ज़्यादा खराब थी।
हाँ
पर मेरे उसमें खून में सब निकल गई।
हाँ,
अब पेट में दर्द बन रहा है,
पेट में दर्द हो रहा है
पेट में दर्द, सीने अंदर
और
चक्कर,
हाँ और
पैरों में दर्द।
पैरों में दर्द। अच्छा ठीक है।
Severe pain in abdomen, especially in epigastric region, pressure and bending double, ameliorated by pain in chest, radiating to back and left arm, palpitation and breathless, severe vertigo, unable to hold herself, sensation as if she will fall, severe pain in lower extremities, more on left side, restlessness, pain in back and extremities, difficulty in walking. History of present complaint, conflict in family. Physical journals, appetite intolerable, thrustless, tongue clean, moist, salivation, taste mouth bitter, desire sweet, curd, intolerance, strong odor, sun, घबराहट, stool satisfactory, urine, perspiration. Mental journals, son-in-law met an accident and no one to take care in his family, so her elder son is taking care of him. Due to this, her daughter-in-law is engaged. So it's a cause of conflict between the son and daughter-in-law. Because that conflict, daughter-in-law left the home. And there is incidents of theft. Her money, someone stolen from her bag. And there are also factor anxiety of marriage of a younger son. At the time, the BP was 90 and 60, perspiration rate was 25, temperature 98.6, pulse rate was 76. Investigations and the hemoglobin is only 4.1. And the plasma glucose level is 90. Rest is normal. And we thought maybe some biliary disorder, liver disorder, so we went this test, it's normal.
पूरा बंद नहीं है।
सीने में तो बहुत जोर से हो रहा है,
और
यहाँ से और सीने में।
और क्या हो रहा है?
तापमान बहुत जोर से यहाँ से लग रहा है, काम से निकल रहा है।
अच्छा, ठीक है।
Pain in chest is still very severe. Patient in agony due to pain with profuse perspiration and restlessness. Pain in abdomen also persists and desire to bending double. This pain in abdomen due to myocardial infarction. Palpitation in ghavrat. The prescription Colosin 200 in frequent repetition. And after Colosin 200, the condition in the evening of the same day.
क्या सही नहीं है?
मुझे ज़्यादा परेशान हो, चक्कर आ रहे हैं
और
पेट में दर्द कम हो जाता है, बंद नहीं होता है।
बंद हो जाएगा, एक आध दिन का टाइम दो। पपीते नहीं खाने हैं, पपीते खाओगी तो दर्द हो जाएगा। आई थी तब से कैसी हो?
पहले मतलब
Pain in abdomen little reduced but repair. Pain in chest persist along with restlessness and profuse perspiration. Mind it is very cold here and the patient is severely perspiration. But I was better. To find out that the colosins is not working, we change the medicine and that is colchicum LM1. So it is very unusual to see to everyone that colchicum in myocardial infarction. I will come to the point why I prescribed colchicum. तो सही हो? अच्छा कितनी सही हो? चक्कर से आते थे वो बंद है, कम है। अच्छा और पेट का दर्द ठीक है, अब कैसा है? बंद हो गया, बहुत तेज दर्द था, बंद हो गया। हाँ। सीने का और पीठ का नहीं है, ठीक है। क्या है? So everyone see that she is much fine by the correct medicine and this is the evening period.
पेट का दर्द तो हल्का है,
हाँ
हल्का लगा हो रहा है, लेकिन पीठ में दर्द होता है।
अभी होता है।
हाँ।
और घबराहट ठीक है?
घबराहट तो सही है,
और
हम पीठ में दर्द से और पाँव में और सीने में दर्द होने लगता है।
जब आई थी उस दिन से कैसी?
उस दिन से तो बहुत सही है।
ठीक।
So patient is recognizing and acknowledging that she is much better after the prescription of colchicum. Pain in abdomen markedly reduced, pain in extremity much better, vertigo appeared, not appear today. Back pain persist, which radiate to chest and left hand. Patient is much better. Colchicum LM2. So question arises, why colchicum? So I put this slide, a photocopy of Allen's keynote. Look this line, elements from grief or misdeed of others. So this is the whole idea prescribing colchicum. Misdeed of others. There is fighting between daughter-in-law and son-in-law. Somebody stolen money. So these misdeed of others caused patient acute myocardial infarction. Look how happy she is in the day 4. Only after intervention of the colchicum.
लेटे हाँ। अच्छा चलने फिरने में कैसा है अब? आ रहे हैं? अभी भी आ रहे हैं? हाँ। रिश्तेदार ज्यादा आ गए। और क्या हो रहा है? अच्छा ओके,
जैसे मतलब चालन की साइड से दर्द,
जहाँ पे दर्द है।
नहीं यहाँ से दर्द होता है,
हाँ,
फिर सभी बहुत लगता है, कोई चीज नहीं आ जाता।
Vertigo appeared. Many family members came to meet her, tired as she talking to them continuously. Otherwise, she is much fine. Pain in chest reduced, slight pain in back, nothing significant. So the same medicine, same potency, and same repetition, 1 hourly. The day 5.
ठीक हो? क्या क्या ठीक लग रहा है? सब कुछ से मतलब?
दर्द से,
हाँ
चक्कर से,
हाँ हाँ, सही लग रहा है। चलने में? हाँ, वहाँ पर है। ओके, अब नहीं लग रही बाकी कोई कमजोरी? ठीक है। तो जिस दिन आई थी तब से कितना बेहतर महसूस कर रही हो? मतलब रुपए भर में कितना आराम है? हाँ, क्या? अच्छा।
2 बार इतना पसीना आया, इतना पसीना की घबराहट हुई, कपड़े कपड़े सारे भारी सब उतारते मुझे नहीं होश, 2 बार।
ओके,
तो दूसरे दिन तो कुछ सही से सही
ओके,
कैसे रोका तुम्हारे
Feeling very good, no vertigo, no pain in chest, no restlessness, no perspiration, only slight lumbar pain. We increase little potency, colchicum 03, repetition the same. Now discharge today. वैसे कितनी ठीक हो? क्या दिन भर्ती रही? 6 दिन में। 6 दिन में कितनी ठीक हो?
मैं बहुत सारी बातें तो आई थी, बात स्टार्ट हो से मरी थी।
हाँ, मरी जाऊंगी, मर जाओ। पसीना, माइग्रेन इन्फेक्शन था ना इनको, तो माइग्रेन इन्फेक्शन में और 90% ठीक हो गई इस स्टेज में, जैसे पावर ऑफ होमोपैथी।
तो पूरा ये चेस्ट से और बैक से पूरा हाथ तक पेन रहता था यहाँ पे से।
क्या दिया बेटा?
सर कॉल्चिकम 0/3 बना कर दीजिए।
कॉल्चिकम 0/4। So basic. This is the last prescription. Today morning, colchicum LM4 and 2 hourly, and with the advice to visit after a week. Stop speaking. I would like to show one more case quickly. क्वेश्चन बाद में करेंगे। आप करो, So this is a case. करो। कैसे से
नहीं, इसका सिस्टम अलग है। अरे नहीं,
शेर आ तो रहा है,
शेर आ रहा है, साइड में आ रहा है।
ओके, अब आ गए।
हाँ,
So it is a case of multipathology, diabetes, mellitus type 2, hypothyroidism, severe breathlessness with hypertension. This case, बाबू ये इसको कहाँ से लेना है? यहाँ से। This, when the whole world was shut down, no hospital was running, and we were the only hospital of homeopathy was running and taking care of the patient. She got admitted on 15th July 2020. ये वीडियो प्ले कैसे होगा, इसको हटाना पड़ेगा यहाँ से।
बहुत ज्यादा
घबराहट होती है,
बेचैनी टाइप से।
अच्छा,
मतलब ना तो बैठती बनती है ना खड़े होते बनती है, और सिर में दर्द होता है रात में। और ये कनपटी में होता है, ये कनपटी में होगा और ये होगा। और अगर आज 5 घंटे में सही हो गया तो मुझे, और नहीं हुआ तो या तो मैं दवा खाऊं या फिर किसी से दवाओं का। अब आप सोचो कि इनके हाथ या किसी भी लड़के के हाथ कितने कड़े पड़ते होंगे, और कुत्ते के बावजूद मुझे दर्द कम महसूस नहीं होता, इतनी स्थिति।
अच्छा, एक काम करिए, अभी क्या
Severe restlessness, intolerable headache, breathlessness, aggravates on least walking, diabetic, hypothyroidism, chest pain, anxiety. These are the presenting complaints. Past history: cholecystectomy done 20 years ago, gastric ulcer in 1994, blood transfusion 3 times. Family history: father hypertensive, grandfather paralyzed due to hypertension, sister hypertensive, mother paralyzed, uncle paralyzed. So everyone has hypertension. Appetite good, cold food, thirst, thirsty, tongue tip red, not specific, desired curd, mango, aversion sour, intolerance to sun exposure, causes headache, is too satisfactory. Urine frequent urination, heart patient, sleeps on back 7.5 hours, perspiration profuse, and general tendency fear of height. Desired company: anger expressed by shouting, consolation, aggravation, introverted, forgetful. So my prescription to this case was LM1, a very rare remedy, but I use this remedy very nicely in my RPD, and my all students understand to whom strophanthus should be given, in what conditions should be given. So just we gave her 4 doses in the OPD itself.
अब सुबह से काफी शांति है।
काफी शांति है, जब शांति है। अच्छा ठीक है, तो हम भर्ती कर लें आपको। So after 4 doses she was feeling better, then we advised to get him admitted, and she got admitted now. So this is a video of same evening. Look how she is happy. बहुत अच्छा। See the happiness of patient. That's the key. Patient is much better and happy. Cystophanthus LM1 same potency and repetition 1 hourly now. Next day morning. नमस्कार, कैसी हैं? कल के मुकाबले अच्छा है। सुबह घूमी है?
हाँ, सुबह घूमी थी।
क्या बजे घूमी है? अब आप दोबारा 8 बजे 5 बजे घूमी, 5 बजे घूमी, 5 बजे घूमी, फिर 8 बजे घूमी, 7 बजे नहीं, 2 घंटे करनी है। 8 बजे घूमी, 10 बजे घूमी। हाँ, मैंने कह दिया था कि 5 मिनट ज्यादा नहीं, फिर 5 मिनट के बाद 6 मिनट ग्रेजुअल पेशअप करेंगे ना, तो स्ट्रेंथ आ जाएगी बॉडी। Patient is feeling better. She is walked morning. Strophanthus LM1 repetition 1 hourly. Next day morning. सही है, बात कर लेंगे। सुरेश चंद्र कितना चली है?
लैट्रिन तो बहुत कड़ी आ रही है।
कहाँ पे?
ये
सांस की क्या पोजीशन है? सही है। तबीयत कैसी है?
तबीयत और सब बात
सही है। सुबह चेक किया? सही है। देख
अच्छा ठीक है।
relief of the patient, relief in breathlessness, constipation, pain in pubic region, Strophanthus LM1, काट दीजिए। स्टोफेंथस LM1 रिपीटेशन 2 आवरली। हाँ जी,
पर वो वेबिनार में है सर, एक वेबिनार प्रस्तुत कर रहे हैं।
हाँ जी, नमस्कार। बताइए कैसे हैं? डायबिटीज तो आपका कंट्रोल हो गई, ठीक है। डायबिटीज दवाई मत खाना कोई दवा, बस डाइट यही खाओ जैसे बताई जा रही है, ठीक है। बाकी चीजें देखते हैं। कितनी बार घूमी है दिन में आज?
बराबर
पूरे दिन कितनी बार घूम चुकी है?
2 घंटे के अंदर
कितनी बार घूमी है बताइए? So she is much better in D2 only, 2 days, and diabetes is controlled. Those who say that diabetes is not curable, watch this conversation with the patient. Stofenthus LM1 repeated 3 times a day. ठीक है, बढ़िया है, खुश हैं, ठीक है। कल छुट्टी करेंगे आपकी, ठीक है। Patient is very happy, all complaint better, same medicine, same potency, reduced repetition. Now it's only 3 times a day. Discharge on 5th day. कैसी तबीयत है? बढ़िया। कितनी बढ़िया? बहुत बढ़िया। बहुत खुश हैं। कैसा एक्सपीरियंस रहा? बढ़िया। डायबिटीज ठीक हो गई? बिल्कुल बिना दवा के कंट्रोल है। और सांस फूलती थी वो नहीं फूल रही, बिल्कुल स्वस्थ महसूस कर रही है। क्यों था? कोई बात नहीं, वो भी ठीक हो जाएंगे। डायबिटीज तो बिल्कुल ठीक है। हाँ, आपके बराबर में दूसरे वो इंसुलिन नहीं लगा रहे, आप तो सिर्फ गोली खा रही थी, जो इंसुलिन भी बंद कर।
ब्लड प्रेशर की?
हाँ, ब्लड प्रेशर कैसा है? सही है। कोई दवा नहीं खा रहे?
थोड़ा सा ज्यादा जल्दी तो भी फूल रहा है।
मतलब ये है कि डायबिटीज ठीक हो गई, सांस ठीक हो गई और ब्लड प्रेशर ठीक हो गया। क्या दिन लगे? 5 दिन। देख लो। और क्या बोलते हैं, जिंदगी भर दवाई खाओ, ठीक नहीं हो सकते।
तो इसकी दवा अभी तो रेगुलर नहीं।
सेम मेडिसिन, नो कंप्लेंट, डायबिटीज बेटर, ब्लड प्रेशर कंट्रोल, and the breathlessness also controlled. Follow up next in the OPD. पहले के मुकाबले कितने ठीक है?
काफी हद तक
परसेंटेज में बताइए।
परसेंटेज में ये है कि पहले ये 10 कदम चलती थी, हाँ, तो सांस फूल जाती थी, हाँ। अब ये अगर 50 कदम चलती है उसके बाद, अच्छा, ये
मतलब अब 10 से 50 कदम पे पहुंच गया, तो ये मालूम है कि 80% ठीक है।
हाँ, लगभग उसमें इतना फर्क नहीं पड़ता। और ऊपर सीढ़ी भी चढ़ जाती है,
सीढ़ी चढ़ पाती है।
हाँ, तो आप 2-3 छत पे भी चली जाती है, छत पे टहलने के लिए।
बहुत अच्छा। और डायबिटीज कैसी है आपकी?
डायबिटीज रेगुलर ठीक है,
बिल्कुल ठीक है। एलोपैथी दवाई तो नहीं खा रही? बिल्कुल भी नहीं। सब छूट गई?
आप एलोपैथी की नहीं, हमने डायबिटीज की
कोई दवाई नहीं ले रहे?
कोई दवा नहीं।
इसी दवा से
137 कल आया सुबह, हमने
137 सुबह आया। और खाना खाने के बाद कितना?
176
है। Strophanthus LM2 4 times a day. Latest of this month follow.
तबीयत कैसी है? अच्छी है। क्या क्या अच्छा है? हाँ, वो तो गिरी थी। अगर हम ये गिरने वाली बात भूल जाए तो जब आप यहाँ आए थे तब से कैसी हैं? क्या क्या चीज में सबसे बेहतर महसूस की?
किसी प्रकार की कोई दवा नहीं ले रही हूँ, सबसे फर्स्ट में, और बस ये वाली दवा पी थी और स्वस्थ।
ओके।
किसी प्रकार की मतलब कोई टेंशन नहीं है।
तो अगर मैं पूछूं 100 में से कितना बेहतर महसूस कर रही हैं, तो कितना परसेंट? रुपए भर में कितना? 75-80। ओके। तबीयत कैसी?
That's all from me. I'm open for question if any.
Okay, sir. Or as always, your work is very inspiring. So I want to. There are some questions which are being asked, and I want to ask you a few of them. The number
Okay.
one question is the second case. The case of Strophanthus was very interesting. Can you tell us what is your indication of Strophanthus? On in which conditions you have used Strophanthus with good results?
Gaurang, I am the firm believer of Organ and aphorism 5.
Hmm.
My whole practice, maybe outdoor patient, maybe indoor patient, depend wholly and solely on the aphorism 5. And this aphorism 5, whether it is acute or chronic, is written very beautifully.
Hmm.
In the chronic case, the Hahnemann has mentioned the ascertainable physical constitution.
Hmm.
So the lady was a ascertainable physical constitution of Strophanthus. That's why I use Strophanthus. In the Boric Mathematica, Strophanthus is written very nicely, but in last 35 years I have a deep insight in the Strophanthus,
Hmm.
and it works magically.
What is
And
your indication? Generally, you use it when it's along with some cardiac or renal condition, or what are two or three very peculiar things you can tell? Because there are many questions about what is indication of Strophanthus. Just about 20 questions, so many questions actually about them. So that's what they are. Just magical use of Strophanthus by Dr. Pradeep Kumar Gupta is what they have to answer. So
I say one line, I repeat again, the physical constitution.
okay,
Strophanthus is like calcarea, but it
okay,
is much bigger than calcarea.
okay, interesting.
The muscles are very much weak.
Hmm,
So that is Strophanthus. She
interesting.
was not able to move. She was not able to just walk 10 footsteps. Now, only in few days, only one day she start moving. Only in few days or few weeks she start climbing the stairs. So this is Strophanthus. The
Interesting.
muscles, yeah, muscles. The word you use corpulent constitution.
Yeah.
It is the word used by Boric. So
Hmm.
our great grand seniors use so beautifully the things we does not understand. So this is in corporate constitution. That's
Beautiful.
a whole case of Strophanthus.
Absolutely beautiful case. Last two or three questions, and this is my question to you. I'm going to ask you one very important question. There are many students here watching all across India, Europe, and Brazil, and many different countries here. So, what
Okay.
is your? How do you develop? How? What is the secret, and how do you develop a mindset of treating such pathological cases? आप में वो, where does that kind of willpower, that kind of state of mind come from? Where does that passion come from?
Gaurang, homeopathy is a very wonderful science. It has all the answers to everything. Nothing incurable. I say nothing incurable in homeopathy if you understand the patient as well as medicine. So, to understand patient, the aphorism 5. Beyond aphorism 5, nothing. Only application of aphorism 5. And materia medica, you have to develop the insight. As I told lastly, for Strophanthus is corpulent constitution. So this is the words we have to understand what it means, what we make out with our patients. I have shown a case of multiple fracture in a lady. and I prescribed gelsemium. And she was wonderfully all right. Might you have seen that case that is also available on my Facebook page. So here I use the whole dictum: the muscle refused to obey the will. So muscle bones are also the muscle. So they refuse to obey the will and they break down. And that was beautifully cured by so much more than 50 fracture in the body of that lady, stress fracture, and became all right. So you have to understand the materia medica also with the same pace, with the same intent, and very few things which are disrupting us, that this is acute medicine or that is chronic medicine and that is, I don't go in such. Medicine is medicine. I show you strophenthus and I show you colchicum also in myocardial infarction. Use, yeah, you should have a ear like Ganesha to listen patient. Yeah, to listen. So if you start listening and understanding from the core of heart of the patient, from the core of heart of the attendants, and you watch them carefully, then nothing is impossible. What is possible and impossible, that is for only allopathy. What is pathology, that is the just understanding. What do you think the pathology books are all correct? A small COVID virus they can't treat. So what is the use of such a things? I am not commenting, I'm not discrediting anything, but I'm just putting facts in front of you that whole world was very much, still world is very much down with the COVID, and Neminas was never tried to treat. And we treat so many cases with so lot of restrictions imposed by the government and by everyone.
One last question that participants are asking, and this is especially from students and many students across the colleges, because everyone is not lucky enough to study with you, along with you, because there are many different colleges from different parts of India and the world. What is for you, what how does a student, a homeopathic student, study? How does he visualize his life? How does he become someone as profound, as such a good practitioner like yourself? What is your message to them? What would be your few words of advice to them?
Learn homeopathy, live homeopathy, dream homeopathy, eat homeopathy, sleep homeopathy, profess homeopathy. So the one word is that your all the body, just Professor Subhash Singh sir said synchronization of the same term. I say synchronization of the personality with homeopathy. You synchronize homeopathy, you sleep homeopathy, you eat homeopathy, you read homeopathy, you dream homeopathy, you do homeopathy, and then you succeed.
Interesting, so interesting. So thank you so much for joining us and giving us such a inspiring talk. We are so humbled and grateful that you were able to give us some time, and so many people are inspired. Thank you so much, sir.
Thank you, Gora. Thank you very
Thank
much.
you. Thank you. Okay, so we have our so that was a great session by Dr. Pradeep Kumar Gupta, and now we have a very inspiring teacher. The next in our speakers list, we have Dr. Manish Bhatia. Thank you, sir, for joining us today, and we are really grateful that you're here, inspiring our students about your approach. Sir, your audio is maybe your audio is not working. No, sir, we can't hear. We are unable to hear.
Can you hear me now?
Yeah, we can hear you. We can hear you much better than before. So So thank you so much for joining us, Dr. Manish Bhatia. I don't have to introduce someone as popular and legendary as Dr. Manish Bhatia. He has been one of the most inspiring figures in homeopathy in today's time. So I think without any wasting of any time, we would like you to start your talk and inspire our students about your approach and how you kind of share your cases. Thank you so much.
Thank you, Gaurang. A very warm hello to all of you. I believe there
Slightly,
are
sir,
lots of
your audio is slightly lower, so you'll have to either speak a little loudly or either the volume. That's about it.
any better.
Yeah, can you speak now?
Yes, is it better?
It's better? It's better. It's comparatively better. Yeah,
Okay.
perfect.
So, okay, great. So, what I would like to say, Gaurang, first of all, I'll not be showing any cases today because when you say that how do you deal with difficult cases, uh, for me, every case is difficult. It could be a simple coryza, a simple fever. A case doesn't become difficult because of its pathology. A case becomes difficult because you are unable to get to the bottom of the case. And getting to the bottom of the case doesn't, the pathology is not a deterrent to it. So if you feel that Parkinson's is difficult, a cancer is difficult, locomotor ataxia is difficult, myasthenia gravis is difficult, no, they are not. The cases per se are not difficult. They are pathologies which are difficult to heal. The body has limitations because at the end, what we do, we facilitate our body's own defense system, own healing mechanism to cure. What is it that your body, what is it your the belladonna is doing, or your calcarea carbonica is doing, or magnesium carb is doing, or strophanthus or chelidonium is doing? Any remedy for whatever be its name in any kind of pathology, what are you doing with that pathology? Is your remedy hitting the pathology, or is it allowing the person to heal? So, what I believe is that it is not the pathology that makes a case difficult. It is your ability to get to the bottom of the case that makes the case easy or difficult. If the case is of a difficult pathology, so to say, but you have able to reach the core of the case, if you are able to identify what Hahnemann says, exciting cause of the acute disease and the fundamental cause of the chronic disease, then that case is very much curable. Now, there are a couple of things that I would like to add here. In this webinar itself, you are going to say, see six legends, so to say. I'm a bit uncomfortable with that adjective because I believe that I'm still a very much a student and still to do something that I can call legendary. But I'm happy to share my journey with all the students so that they can make sense of all these different diverse approaches, radical cures that you see in webinars and seminars in all this lockdown period in this last 1 year. All of you must have attended dozens if not hundreds of webinars with different school of thoughts, different approaches. How do you make sense of it? Which approach works better? There are so many different approaches that you are exposed to today. There is basic homeopathy that you are taught in colleges. Then there is a school of thought from Dr. Vijayakar, who is sadly no more with us now, but the school very much is here. There's Dr. Sankran with his sensation method. There's Dr. Segal and HHF also. Very Dr. Mayuresh is going to speak after me. So very inspiring work from there. There is work from Sholton. There's work from Kandigabe. There is Calcutta School of Thought, and so many other different people who have worked, contributed amazingly to homeopathy. The problem today with students, because I'm raising this topic today because seeing some difficult cases being treated by someone very senior, it can do two things to you. One, it can inspire you. Another thing is you can at times feel less confident of your own abilities. So, simply because what you see in seminars, in webinars, is not the whole truth, not the whole truth of the practitioner showing the cases, because that is not the whole practice. The young student must realize that homeopathy is not a magic potion, even in the best of the hands. Even in the best of the hands. I have been fortunate enough uh, to sit with, to see uh, cases and methodology, and have very long communication and conversations with some of the best in the world. And I would like to tell all the students that don't feel that the people who are at the top or the people who are giving the seminars, they are out of this world. No. When we started, we were just like you, beginners, still struggling to find the meaning of homeopathy, still struggling to find our way with all these different approaches, still struggling with materia medica and repertory. And it is never a cakewalk, never for anyone. You can ask anyone, be it um, Dr. L.M. Khan sir, Dr. Subhash Singh, Dr. Mayuresh Mahajan, Dr. Pradeep, even Dr. Gaurang is here, and so many other legendary homeopaths out there. Ask anyone, it is never a cakewalk. Success is built only by hard work. As Dr. Pradeep just said, that you have to live homeopathy, you have to breathe homeopathy in and out every single moment. Having said that, I would like to add a couple of things here. One thing uh, is about success rate. I have been with some of the best homeopaths in the world, and I can tell you as an insider that nobody has a 100% success rate. The highest success rate that most homeopaths can claim is around 70%. Probably the best and the best probably can hit 80% at times, but 70% is usual figure that I have been able to monitor with some of the best homeopaths. So don't feel that if you are doing 40% you are very far behind and that you have to do 100% to become legendary. No. Even if you are anywhere above 50 percent hit rate with your remedies, you are a phenomenal homeopath. So don't feel that you are not on the path of being a legendary homeopath. You all have the potential. The people whom you call legendary, they are not very different from you. If you sit in our practices, you will see that uh, it's not that we are not using common remedies. Not every case will be solved by a rare remedy. We prescribe calcarea carb as much as probably you do, and not calcarea silicata. It won't be a very common prescription. We'll use it, but obviously, the bread and butter will still be a lot of the common remedies that you all know. So you don't have to know 500 remedies to become an excellent homeopath. Most of the cases that most of the homeopaths are treating today successfully are still the remedies that were proved by Hahnemann and Herring. So that is around 99 remedies or 100 remedies from Hahnemann and another 72 from Herring. So even if you know those 172 remedies, you are very good to go. You will be able to handle majority of your cases successfully because rare remedies are needed rarely. Common medicines are called common medicines because they are indicated commonly. So don't think if you don't have the depth of materia medica where you need to know every single small medicine given in boric, till then that time you'll not be able to be successful. That's a myth. However, I would say that you have to have your basics right. The one common thing that I have seen across all the legends, all the great homeopaths, even of any school, Their basics are very, very good. The basics of materia medica, the basics of repertory, the basic understanding of all the common 100, 200 remedies. uh, any school of thought, they might have a slightly different way to reach the remedy. They might have a different, slightly different approach to solving the case, open up the case. But anyone, be it Dr. Sankran or be it Dr. Sarkar or Dr. Sehgal, Dr. Vithulkas, Jeremy Shea, Jan Scholl, they all these have different approaches, but they all are very good with the basic homeopathy. It's they know their rubrics well. They understand the basic common remedies very, very well. So if you are on that path to solving difficult cases, and difficult cases don't need always difficult remedies. Most of the difficult cases are treated with simple remedies. And because tell you that the pathology doesn't, you're not treating the pathology, you are treating the person. So if you are treating the person, then the person can be treated with the indicated remedy, not based on the pathology, but on the totality of the symptoms. And we are taking the totality of the symptoms in the account. You will see that you will often be able to treat a significant majority of cases with a lot of common remedies. So how one thing I would like to tell you is that make sure that your basics are very good before you actually go to the journey uh, of following any school of thought, following any particular physician or a homeopath or a legend. Make sure that your basics are in place. Nobody can teach you uh, how to cure a patient if you do not have your basics in repertory and materia medica and organon in place. Nobody. There are no shortcuts to success. Absolutely no shortcuts to success. If you have not worked hard in your undergraduation, and if you feel that probably 6 months of internship with a senior homeopath will do wonders to you, it'll help you, but it'll not help you reach your full potential if your basics are not in place. So make sure if you are doing UG, if you're doing PG, make sure your basics are right. Another thing I would like to say is that uh, with this exposure to different school of thoughts, don't feel that there is no commonality in them. Think of it like a painter. Even if you are a painter, now many people I speak to say that homeopathy is an art. So an art form, as an art form, the artist can do anything. It is not just a science. So you have got free expression. I totally agree, you have got free expression, but does art have boundless expression without training? No. When you are trying to become an artist, the first thing you are taught is how to hold a pencil, how to hold a brush. You are made to learn difference between the different types of brush, different types of pencils, different types of colors. Then you are made to draw. You're not made to draw portraits. You are initially made to draw simple lines. You mastered making the straight lines, curved lines, and then you go on making basic shapes, and then you come to figures. Once you have mastered the basics of painting, only then you are able to add your own artistic expression. So that is the way homeopathy works. There are some certain basics. The law of similia has to be there. Your remedy has to cover the basics of the patient. You cannot give a remedy based on assumptions. Any remedy that you are giving to the patient has to follow the law of similia. Now, your definition could vary of law of similia. Your understanding can vary of law of similia. What symptoms you give importance to, that can vary depending upon the school of thought that you are exposed to or that you intend to follow. But uh, what I have personally seen is that even if you are following a particular school of thought, say sensation method or HHF, if a case is taken as a whole, you can reach the remedy, same remedy, not just with the same school of thought, with different schools of thought. And I've seen some of these master homeopaths reaching to the same remedy in different cases. So that is not something difficult. A good remedy, a good prescription uh, covers not just the common symptoms, the pathological affinity of the case, the constitution, the mind symptoms, the delusions and sensations, and uh, a, a good prescription usually covers all of it. And the more aspects of the case your prescription covers, the easier it is to treat the case and the more confidence you have in your prescription. And that is why it is essential to know remedies well. And when you are treating, you have to realize that another thing that I would like to add here is it is not necessary that your first prescription will be able to cure every chronic case. I have spoken to a lot of senior homeopaths, and most of them say, and all of them are legendary, I will say, much legendary. Whom the people whom I consider legendary, I consider myself a student, and there are people much more experienced to me, and I personally consider them legends of homeopathy, and I've been considering them legend of homeopathy when I was a student, just like all of you. And what I have been able to learn from them is that it's not necessary that your first prescription will be able to cure every chronic case. And there are stages of the chronic case. Sometimes there'll be cases which will respond to one remedy, and that's very good. There are very good cases to show in the seminars. But not every case resolves to one single prescription. Sometimes the symptom picture changes, and you have to change the remedy, and that is the way it has been written in the organon. In Ogden, also, Hahnemann has said very clearly that if the symptom picture changes significantly after your first prescription, the second prescription needs to be reevaluated and probably a second remedy if it is indicated, then you have to not be ashamed of giving it. So, a homeopath doesn't become legendary by if he treats 100 cases a day. A homeopath doesn't become legendary if he knows 4,000 remedies by heart. A homeopath doesn't become legendary if he's treating all the cases that he shows with single remedy or single dose. You have to realize that we all have a mixed bag of successes and failures. I still do have a lot of failures. Now, what is to do? What is it that you need to do if you get failures? One thing is you need to learn to introspect. As Dr. Pradeep just said, that when you are taking the case, you need to have the ears of Ganesha. Hahnemann has very clearly said that when you are taking the case, you have to be in a Zen-like state, where you are not, where your senses are open, all the antennas are open, and you are not able to hear or see anything except for the patient. You have to be like the Arjun who can only see the eye of the parrot he has to shoot. So that kind of dedication and focus is the first and foremost thing that is needed. But once that step is achieved, you have mastered your repertory and you have mastered your materia medica, you know the basics of organon. You will succeed in lot many cases, but then you will still fail in lot many cases. Now, how do you improve your hit rate? How do you improve your success rate? One thing is that you need to learn to introspect. What went wrong with that particular case? What happens is that when you start having a slightly busy practice, you don't have time to ponder over your failed cases. But a failed case teaches you much more than a successful case. Please remember this. A failed case teaches you much more than a successful case. A successful case just tells you that whatever you did was right. A successful case doesn't tell you what else you can do, what else there is need to learn. So don't be ashamed of failures. Don't be afraid of making mistakes. What is needed is that when you make mistakes, when you fail in a particular case, you sit back, you analyze the case again, you introspect, you sometimes take the case again. At this point of time, when I have like nearly 20 years of independent practice behind my back, I still, there are cases where probably I have to take the same case 4 times, 5 times in a span of a year, because I'm not able to get the desired result. The patient might be happy. Look, another thing that you need to understand is that the initial reaction of the patient or the happiness of the patient, uh, it can be an indicator of your remedy, but you also have to realize that a lot of other factors go in. Like the scientists have found out that empathy increases your remedy reaction by 40%. So even if you are talking to the patient, listening to the patient very intently, if you are hearing the patient very intently, if the patient is able to open up to you, even with your wrong remedy, the patient is going to feel better for a couple of days, because that uh, discharge of emotions, that discharge of pent up emotions, that feelings, that fears that the patient was carrying, that untold story that he was carrying, the moment that discharge is there, a lot of patients feel better. Now, the yardstick to see is what is the long term follow of that case. Is any case, I have seen lots and lots of cases where the patients improve initially and then they don't stop improving, because a lot of that improvement is not because of the remedy but because of the empathy that the doctor says, because of the opening up that the patient experiences, the emotional discharge that the patient experiences. So don't rush into celebrating your success in chronic cases at a very short interval. Look for long term follow ups of the cases, and any patient who is very sick, who has been sick for years, who is suffering from chronic pathologies, you need a follow up of a year or two at least to be sure that the patient is on the path to cure. Again, I'll say there are some cases which are like the patient has strong vitality, there's functional case, or there is very early pathology, and you see the cases resolving like this. Boom, you give the remedy, and within couple of days or couple of weeks the patient is altered, and we all have these cases. But not all cases are like that. There are a lot of cases where you have to struggle with the patient for 2 years, 3 years before you are able to say, okay, now you are discharged from my, you don't need to come back again. There are a lot of cases where you have to retake the case. There are a lot of cases where you actually change the remedies. There are a lot of cases where you have to move up, move down the potency scale. All these, there are a lot of cases which in between need intercurrent remedies. And so, what I'm trying to tell all of you is that there are no magic potions. Even the best of homeopaths, they don't have any magic potions. They are better. They are where they are because they have probably worked harder than most of the others. They have been more diligent. They love homeopathy more. They have worked harder, and probably they have much more clinical experience than you. But that means that the path to become legendary is open to all of you. My journey has not been different. Your journey will probably not be different if you stick to homeopathy. If you actually live homeopathy day and night, you learn homeopathy, you continue to master your basics, you keep learning from all the great homeopaths you can come. And the students today are very very fortunate. The internet gives them access to so many great homeopaths, so many good video lectures. uh, but at the same time that can be a bit confusing also, and that is why I'm, rather than showing cases, I'm showing you the path, that these different approaches, they are not antagonistic. You can make use of all of them or any one of them, but the first thing that you need to do is make sure that your basics are right. Make sure that you know what uh, even these great homeopaths are doing, so-called great homeopaths are doing, how they practice, and what is the path to be there. Don't be afraid to dream. Don't be afraid to dream. Don't be afraid to become a legend yourself. Every one of you, each one of you has the potential to become a legend in your own right, provided you work hard, provided you get your organon right, provided you get your basics right or in materia medica and repertory. And also remember that curing a case is not just about giving the first remedy. Getting the first prescription is only the first step. Case management is much more vital. What happens when the patient comes to you for a follow up visit? That often decides whether you will be able to cure or not. You can decide to repeat the remedy, you can decide to give a placebo, you can decide to change the potency, you can decide to give another remedy based on Kent's different 12 observations or based on your own learning. But that follow up visit is much more crucial than the first visit, because I have seen more mistakes being made in the follow up visit than the first consultation. Because first consultation, there is a basic pro forma that you can learn to follow from anyone. There's basic classic Kahnemanian case taking, which is often good enough. Then there are added methodologies that you can use. You can use Dr. Segal's approach, you can use Dr. Sankran's approach or Dr. Vijaykar's approach. All these are very good approaches, but these when so you are able to reach the first remedy, but then whether you are able to manage the follow-ups well or not, that decides whether you are able to cure the so-called difficult cases. You'll not be able to cure any case of myasthenia gravis or locomotor ataxia or diabetes or um, hyperthyroidism unless and until you know how to manage the case. And there are no shortcuts to it. You For managing the case, you have to come to organon. I am a teacher of organon. I've written books on organon, and I have experience in nearly all the schools that I've named. But again and again, I come back to organon, not because I love organon. Of course I do. I'm passionate about teaching organon. I absolutely feel that it is the greatest book ever written in medical history. And but at the same time, I come back to organon because I know that the basics have to be there. The case management is an art, and if you don't know how to manage the case, what to do at the follow-up visit, you'll not be able to treat those difficult cases. So I urge all of you to actually, what happens is I often see in colleges that uh, organon is not considered a practical subject. Repertory is considered a practical subject that you're going to use day in and day out. Materia medica is considered a practical subject that you're going to use day in and day out. But organon is considered a theoretical subject that you have to use only for clearing exams. But I strongly feel that organon is not a theoretical subject. It's a practical subject. You can actually live every aphorism. That is what I do in my practice. When I show cases, some of you might have been to my seminars. I actually tell at every stage of my case, look, this is the case now, this is what the patient is saying, and how do you, where in organon is written this particular thing, in which aphorism you can use to analyze this case, be it about physical symptoms or mental symptoms, and then we go step by step. Every aphorism is taken note of, how to take the first case, how to take the follow-up cases, and how to choose the potency, how to decide the repetition. We go by what's written in the organon, and so you can actually live organon in practice. And once you start living organon in practice, then the rest of the things actually fall into place. You actually only become confused about the different school of thoughts if your basics are not in place, if your basic organon is not in place, if your basic materia medica is not in place. So that is what I would like to uh, tell all of you. And I'm now open to questions from all of you. If you have any other questions that you would like to ask, I'm more than happy to take those questions. All right, so till Gorang joins us, I'll share some of my journey with you. When I started uh, as a homeopath, as a homeopathy student, what I did was I fortunately ended up reading organon first and then decided to become a homeopath. And my journey has not been the homeopaths I assisted during my college years. They were both wonderful homeopaths, wonderful human beings. They both used to see more than 100 patients a day, and but they both used to do polypharmacy. And here I was stuck with my book, organ book. I always wanted to practice as Hahnemann has written. So when I opened my clinic, I decided either I experience what I have read in organ, or I don't practice homeopathy, because for me homeopathy is what Hahnemann has written. I'm not a hardliner, lakir ka fakir. I'm open to new methods, new systems, but at the same time, the basics have to be there. So I must be able to see and experience what Hahnemann was able to experience. And from there, in my journey started, where I ended up going to different school of thoughts. I learned from different masters, and it took me years and years of practice and lots of failures to understand. Uh, to make sense of all these different approaches, and then I realized that I have to come back to my roots, my organon. And when I strengthened my roots further, my organon, my materia medica, my repertory, and then everything fell in place. Everything fell in place. All this different systems started making sense to me, and I was able to come to the same remedy using different school of thoughts. So that has been my journey, and that is why I keep reiterating that master your basics and you are all on the path to become a legendary homeopath.
So, so there are certain questions from the YouTube channel that I'll just point out to you so we can get some answers. One of the first questions that few of the participants are asking is, these are many of them are students and probably from different parts. That how should one start to study organ on? How to begin, because it can be difficult, complicated. What could be the beginning to study it?
Okay. I realize, because I have been teaching organons since nearly last 20 years, so I can
Absolutely.
absolutely make sense of that. And that is one of the reasons I wrote my own books for students, because somebody has to actually make the organon easy. And that is what I did with my books, that you have to make it contemporary, easy to understand, and scientific, because a lot of words that Hahnemann has used, they are archaic. You don't find that language anymore. The examples that Hahnemann has used, you don't find those diseases anymore. So at times, yes, absolutely understand they are difficult. Fortunately, there are a lot of good organ teachers today. Two of them are today on panel, Dr. L.M. Khan and Dr. Subhash Singh. They are both organ teachers, and they are very good organ teachers. So if you are fortunate enough, find a good organ teacher. If not, then there are a lot of online resources available. You can buy my books also. A lot of different approaches to but of course, there are again no shortcuts to hard work. If you feel that somebody can spoon feed you organon, no, you cannot. You have to actually live, you have to actually experience organon. In cases, if you are blind to organon while you are taking your case, then you cannot learn organon.
The other question that many of the participants are and the students are asking is that, as a homeopath, there is a lot of void and lot of low confidence about the future and how they will be able to handle, and their confidence level. Somewhere that's what they have written. So, how can they work on their confidence level? How can they become as affluent, as willpowered as some of the people here on our panel today? How do they be? How does a 25-year-old work on his mind as a healer himself, so he can be where he wants to?
There are a lot of things that you need to understand. First thing is, what I have seen a lot of young generation doing today is that they don't want to give in a lot of time. They want very early success. आज क्लिनिक खोला है, 3 दिन बाद तो हम मतलब शहर में मतलब नाम होना चाहिए हमारा. um, they'll invest in good infrastructure, good marketing, but again what I feel is that it's not sufficient. uh, Homeopathy is like a fruit that takes time to ripe. Your patients are your best teachers. Even if you have learned from any homeopath in this world, your patients will remain your best teacher. So if you don't give your time to patient, and if you don't give yourself enough time to mature as a homeopath, if you are in a rush, then you'll always be in low confidence. So don't be in a rush. Give yourself a couple of years, train well, attend seminars, learn from good homeopaths, see other success, that's inspiring, but work very hard on your own cases. Every successful case that you are able to treat will add to your confidence. Nothing else will add to your confidence. Seeing my cases will not add to your confidence. No, absolutely no. My cases, you can inspire you, but they will not teach you beyond a certain level, and they will not add to your confidence. You can be, my cases can add confidence in my abilities to for you, but my cases will not add confidence in your ability in you. Your cases only can add confidence in your ability in you. So treat as many patients as possible with due diligence, with a lot of hard work, and with every success your confidence will increase.
Absolutely. So thank you so much, sir. Thank you so much for coming and giving this words of advice, and it's really inspiring for us. And I also want to thank you for writing a note about the book which I sent you. I'm very grateful for that, sir.
Congratulations, Gorang, on yet another book. I'm sure it's going to be a bestseller, and it's a wonderful book that you've written. Lot of good
Thank you.
things to learn, and very good book. If you are going to, somebody is trying to master repertory, then Gorang's book is definitely a must-have.
Thank you so much, sir, and thank you for giving us a beautiful talk. One question, one last information is: can you just share a little bit about the name of your book and how do they contact you? Few doctors have written in the question list. Many of them are probably hearing from different parts of the country.
All right. So my books are called Lectures on Organon of Medicine. They are in 3 volumes: volume 1, volume 2, volume 3. And these books are recommended by Central Council of Homeopathy also for both undergraduate and postgraduate MD home courses. And they are used all across the world as standard textbook of organon. And you can buy them on Amazon or Flipkart if you are in India. If you are outside India, then you can purchase them at drbhatia.com, which is my website. You can know more about these books at drbhatia.com. And that's it.
Okay, sir. Thank you so much. Thank you so much
All
for
right,
joining us,
Gorang, thank you
and
so much.
thank you. Thank you.
से एक्चुअली मैं तो बोल रहा हूँ
सर हीरो का एंट्री हो गया ऐसा लग रहा है. पूरा हीरो का एंट्री हो गया सर. एवरी टाइम व्हेनेवर योर एंट्री इज देयर ऐसे ही कुछ होता है, एंड देयर इज लाइक अ बिग धमाका, एंड you come in the your audio is closed.
अच्छा.
Now is open. Now it's open.
Am I audible?
Yeah, perfect.
But I can't see the screen, Gaurang. Yeah. I'm back. As usual. Very poor techno. Yeah, Gaurang, how is the feeling now? How are you feeling now? I would like to ask you one thing. How are you feeling?
Don't ask me. Did you like the book? Did you like the book?
Of course. That excitement must be there, right?
Absolutely.
The same. You're selling through the same board. I was also the same excited when I was opening this Little Angels.
Absolutely.
First of all, Gaurang, I would like to congratulate you for this.
Thank you so much.
The repertory, very different style you had chosen for this book. The rubrics and all, very good. You have put your heart in it. I wish you all the best. Okay.
One of the teachers who have dedicated the book is Dr. Milind Rao, sir. You can see his small sketch in the book if you get a chance.
Yeah, I know. I'm very happy for that because yes, Gaurang, Milind Rao sir used to dream of this type of webinars. Every school of thought process coming together under one roof. Yeah, it's really very. I'm missing my master right now. Yeah.
A great legend. No words for him, sir.
Yes.
So many people are waiting for you. I'm not going to waste, and I'm not going to waste seconds. I'm going to put you on stage because everyone is waiting for the hero of the entire session. So
Hey,
yes, sir.
now please don't embarrass me, okay?
Okay, sir. I'm going to go off screen so that you can teach, sir. Yeah.
Okay.
Okay.
So, ready. First of all, my friends, students, friends, seniors, a very warm welcome to all of you, my dear friends. A wonderful event. It's a privilege for me to be a part of this webinar, and I would like to congratulate Gaura making this event so successful. So I'll directly start the case. I'll directly start the approach. So Gaurang has requested for the approach towards pathological cases, deep pathological cases, or difficult cases. Actually, as every speaker, first of all, I would like to tell you something about the speakers. Subhas Singh sir, Dr. Pradeep Gupta sir, really it was worth listening to you, and we got some new insights about colchicum, strophanthus, about or homeopathy, organon. And Manish, my dear friend, it was nice listening to you. Okay, and yes, there are some thoughts we need to go, we need to grow together. Integrity is the key now. I would appeal every single homeopathic physician who is listening this webinar. I would like to tell them, rather plead them, there's a time to come together. It's a time to come together. And I have selected such cases. It's not just that I wanted to have selected it, it has some purpose behind it. The purpose is to instill that confidence amongst the basic budding homeopaths. I would start with the cases. I would start with the PPTs. Okay. So we'll come to know what is the approach. I will be sharing two cases. One is a case of cellulitis leading to gangrene. And imagine the person was sitting in front of me, and I was really worried about what to do now. That is the case, and I'll narrate. It will be a case of 7 to 8 minutes. So stay tuned. Second case will be a case of squamous cell carcinoma, and that was also a very dangerous case. So let us start with the case, the PPT. He 21st edition. Now this he PPT. Very good. No, I'm just one second. Sorry, please stay tuned with me. Vertical answer. Oh. Yes. Okay. So the time starts now. Okay. See, Homeopathic Marathon Masterclass 21st February 2021. First of all, Masterclass, it's a bit, big, it's very difficult to digest this Masterclass. As Manish told, it's a Sir Subhas Singh sir and Pradeep Gupta sir, yes, they deserve it. They are legends. We are in this process of learning homeopathy. We are yet learners. And I tell and I request every student to be a learner till the end of his journey in homeopathy, because every now and then you'll get to see new cases. Every now and then you'll get to see new rubrics, failures. It's interesting. So this is the marathon seminar, and this is approaching difficult cases. As everyone, Subhas Singh sir, Pradeep Gupta sir, as well as Manish said, see, every case is difficult. But the interesting part is, let us make it simple. The objective of my webinar is to make things simple. So let us take a case of gangrene. Okay, and for the newcomers or the new friends of mine here, I'm Dr. Mayur Mahajan. I'm a president of HHF. HHF is an organization founded by my master, my mentor, our mentor, Lindrao. It's a huge family of thousands of doctors together, working together, sharing together, loving each other, and they are respecting the case, juniors, seniors, everything. And we have a tagline of Dil Dosti and Homeopathy, like, Dil Dosti and Homeopathy. We believe in friendship. Okay. And the approach in difficult cases, my dear friends, first and foremost, to the students here, every legendary has already talked about it, and I would like to tell you the same approach in difficult cases for homeopaths is what, the most important is passion towards homeopathy. That faith within yourself. The faith within yourself is very important. Passion, love, eat, drink, drench in homeopathy. And this team, you should have a team with you. You should have a friends gang with you. You will not believe my session is here, and SKD and Yogesh Rajurkar, the three nice men. One of those two of the three nice men are here with me. We have that energy together. This energy should be, infectious. Every person, every single homeopath listening to this should instill that energy within themselves positively, faithfully, and homeopathy just comes like, what is the key to success? Just don't run after success, run after similibum. Okay, sorry. Next slide, please. First of all, before my master Milindrao, I would like to say gratitude to Dr. Samuel Hahnemann, sir, the visionary, the legendary, the scientific, the spiritual, the wise man. 300 years back, he thought about stress. The emotions are the only reasons to fall sick. 300 years back, where the stress level was 1%, and now 80 to 90% of all diseases are of stress. See the vision. Salute to the master, the father of homeopathy, Dr. Hahnemann sir, Samuel Hahnemann sir. And this gratitude is Dr. Milindrao sir, because he's my master, my mentor, my guru, my friend, guide, philosopher, who has instilled that confidence within me to practice homeopathy, and thousands of homeopaths together. So one of them is also, gauranghg is also one of them. And there are so many doctors who have, learned under his guidance. Okay. So master, love you. And so let us go to the case. Individualization is very important. Now I'll tell you what is individualization. What is the approach? What is my approach towards case taking? What is my approach towards case taking? Dreadful cases, pathological, deep pathological cases. What is my approach? No new approach. The old funda of Master Hahnemann sir. The old funda of nothing but PQRS. The peculiar, the queer, the rare, the strange symptom. It may be a physical, it may be a miasmatic prescription, it may be a concomitant prescription. And the most important, and the most I feel, this is what I feel, which is the most important, is the emotional level of the person, the man in the disease, the mind in the disease, the sick. We treat the man in the disease. We don't treat the disease, we treat the person in the disease. So let us try to find out this person in the disease. Okay. Now imagine a case. I'll just show you the case. So this is PQ. Now my whole webinar will be just linked with this P, Q, R, and S. Peculiar, queer, rare, strange. The hatke, the individualization, the peculiar, the deviated, the most uncommon. What Hahnemann sir used to do. The PQRS is the key to prescriptions. And believe me, my dear friends, when you take a case in front of you, any case, any given case of a cold or whatever, the person comes with a PQRS. Our only job is to find out the PQRS. Bas. That's all. Okay, but this PQRS is a big journey, but let us make it some simple. Okay. Now let us move to the case. It is a case. I won't show you the whole case. I'll show you the deadly pathology in the case. See the necrotic tissues. See the wound. It was very deep. It was very deep, my dear friends. Believe me, in this camera, I am not able to show you the deep depth of the wound. Literally, the bone was visible. Such bad pathology. It was stinking. The whole clinic was blossomed with that. But still, I was like, what can be done? This was the case. Okay, so see this, see the deadly necrotic tissues over there. Okay, now the reason behind showing this case is, first of all, when I was in, I will confess in front of you, the first thing what came in my mind was, oh my God. So I got prejudiced. This is wrong. A case may be of cancer, or a case may be of cellulitis, gangrene, or coryza. If you are not prejudiced, ask the patient to come next time, or wait, go down, take a tea and come back. I was really, oh my God. But then I made myself calm. Okay, Mayur, all is well. All is well. Okay. Then I just looked into the face of the patient. Now I'll try to enact the person. This was the patient, okay, in front of me. And it was like this. Now we have to understand the PQRS. Hello, my dear friends, PQRS. Try to understand PQRS. You know, I was really very, anxious about the wound. I was getting restless. The smell was like, it was not about the smell. It was the smell which was indicating that it was absolutely turned towards putrefaction, bad pathology. It has already landed into that. And this guy was like, isn't it peculiar? Hahnemann sir had said, art of case taking. It is an art, observation. He was like this, cool. Can you imagine, and we might take anyone, yourself also, if at all you have a nail bite and it goes into a state of this inflammation pus, and if a small dark spot appears on your finger, what will you have? What will you react about? Oh my God, oh, you'll get panic, you'll get anxious, you'll get restless, isn't it? Oh my God, what is this? Or you will complain, it's paining, it is dribbling, it is not working, it's 90, but it's not working, something not. You try to complain. And this man, the PQRS again, was like this. Now imagine the physician was getting restless. Oh my God. And the person was like this. Person in the disease, the sick person was like this. This is, isn't it interesting? This is deviated state. This is uncommon. What sir used to say, Hahnemann sir used to say, this is uncommon. Focus over there. Spontaneously a question came from this physician, the anxious physician. How come you are so cool? Isn't it? How come you are so cool? Just like this. Again, PQRS. Keep your eyes open and ears alert. I ask a question, simple question. How come you are so cool? This, I could see the wound. It's so dangerous. You also can see the wound. It's so dangerous. How are you so cool? What did he say? It is important. Again, PQRS, the approach towards these types of cases. He said, doctors, actually these wounds, this body and everything has no meaning for me. I was like, what? Yes. He said, this body is nothing. Means what? These wounds, this pain, these sufferings are nothing. Means what? See, I only believe in soul. I was like, I thought I was, somewhere who is professing something. Okay? But don't take the rubric direct prophesying. Please try to understand what he's trying to tell. He says this body is made up of soil and will go into the soil. So it has got no bloody importance. What can what remains is the soul. What remains is the soul. You cannot destroy the soul. This soul, soul, soul. Okay, please. You just don't destroy. You can destroy your body. You can. Everything is finished. The material is, there is no thing in this body. Nothing is this body. It's useless. What is important is soul. That was on the only thing. So I'm not worried. Hence, I'm not. My soul is intact. What was he saying? In spite of this dreadful situation where he's landing into deathbed, and this guy is telling, no, because I'm not worried because my soul is untouched. Nobody can destroy my soul. This wound and everything, these are, it has got no meaning. It has got no matter. What matters is the soul. And I was really wanting. Now my ears, my anxiety, my restlessness came down, because now I was focusing on the case. I thought of something wrong. This is something deviated. This is peculiar. No person in this world suffering from gangrene will say that body doesn't care. I don't care of the body. I care only about the soul, because soul is, you cannot destroy soul. That was the thing. And I came to a remedy and I prescribed him a dose of 30. I'll tell you the name of the remedy. I know you must be excited about that remedy. I have shown this case in a seminar in Nagpur and Hyderabad and Mumbai also. This case, the whole case I had shown, but right now because of this privacy issue, I wouldn't show you this. But see the interesting part. The interesting part was, he said, I gave a dose of that remedy in 30, and within 4th day, he said, doctor, something is better now. Now pain is, the black part is converted into a pinkish part. Well, I was happy. I mean, then, and how are you feeling? Now, doctor, what do you feel? He said to me, the follow-up is very important. He said to me, he asked me, doctor, everything is fine, is it? I hope everything is fine. Nothing more goes wrong, doctor. I think now I'm towards cure. What do you say? What is your opinion? Now he's asking for an opinion. And before dose, what was he doing? Body is nothing. Only soul is important. And now, what is this? 7th day, he sent some pics, 15 days. When I thought so, I was really very happy. I told the patient, be now patient. Everything is going down. Everything is clear. Everything is fine. And you would like to see the pics, right? The pics are like this after the dose. And follow-up was very important. What he was not caring about his disease. Mind has, only soul is important. Mind, this body has nothing to do with. That was broken. That feeling was wiped off from his mind. Remember, this was the case after 10th, 12th day. Okay, it was a bit healed. I won't show all follow-ups. I will show directly the last follow-up. See that this was the follow-up. This was the follow-up, and now after 2 months of rigorous treatment of Saclax and classical dressing skills, see this. This is the disease. Now, this is the magic of homeopathy. I won't say magic. If Krishna Kumar Dinde would have been here, would have given me a tight. He won't give me that. But it's not magic, dear friends. It's science. It's scientific. I'll come to the point. See this. And the remedy was? And the remedy was? Diligence. One rubric, my dear friends. If a person comes to you and say, everything is more, my body has got nothing to do with anything. Only important is the soul. Body is useless. Body is immaterial. Body is soil. Body is mud. Think of this remedy. See, trying to make simple. Things simple. Diligence of immortality. What was he talking about? Soul remains intact. You cannot destroy my soul. Immortality. And the second rubric was diligent. Body is immaterial. Or what? Body is full of material. I won't go in deep into this because there may be people who can share this. But what was his delusion? Body is immaterial. It has come from the soil and will go into the soil. This was something, wasn't it very peculiar, PQRS? peculiar, queer, rare, strange, deviated. Isn't it? Very interesting. So this was how mysticism, this prophesying, moha, maya, this and all those things he was talking about. And the remedy was, I won't, if I start talking about this remedy, it will take minimum 3 to 4 hours to understand this remedy. But I wanted to focus upon the PQRS, how to approach a case in such deadly pathologies. The remedy was anolinum. I would just give a tip of anolinum. Anolinum is a remedy for schizophrenia. And in old schools or in old psychological books, if you refer schizophrenia, one author has beautifully written in a book that schizophrenia is gangrene of mind. Mental gangrene is schizophrenia. Cut off from life. Did you find that cut off feeling of that person from life, from the present? Suffering from gangrene and talking about body and soul? Got it? This gangrene, this cut off feeling from mind was reflected on his body with the symptom of gangrene. And one energy dose of anolinum had that capacity. See, I will show you some other cases where I had given 10 doses, 50, hundreds of doses also. But this dose, I had given one dose because particularly he was talking about body is nothing, body is nothing, body is immaterial, body is immaterial, body is immaterial. It has got no meaning. And after giving the dose, he started asking about the wounds, the color of the wound. So I've got to know that, yes, I have done the right. I have hit the minimum. I have touched the vital force. Now vital force will take care of the disease. This is how we understand homeopathy. Okay. Body is immaterial, anolinum. Please don't forget. Next case. Acha, body is immaterial with thuja bhi hai. We have thuja also. But this thuja is very brittle. What is the immaterial thing of thuja? Glass. One knock and breakdown. It's too cold, sardi, cold. It's too cold, cold. It's too hot, acidity. One dose of Saclac, hard one. One powerful dose, if I'll say, a doctor says, I'll give one dose, powerful dose. Believe me, you'll be fine tomorrow. Doctor, don't give me that powerful dose. Tomorrow I'll suffer. I can't bear that dose. My body is very. That's immaterial means which has no strength, who cannot stand on himself. That is Tujaka. But here in anolinum, the body's immaterial was what? Useless. And what was important? Soul. So that is anolinum. Okay. So next case. It was also interesting. It's 5 minutes. 5 minutes. Okay, it's an interesting case. 5 minutes more I'll take. Again, beautiful case. A case of, I really find it difficult to pronounce the words like this, squamous cell carcinoma and all. With due respect, this case, I had been to a visit. An old man of 87 years old. Oh, okay. A husband, wife, both called me and said, please, sir, can you do something for us? Yes, of course. And Master Rao sir, as well as Dr. Kent has also focused upon the wonders of bedside prescribers. Please, at all you have any visits, please go there. You will get some insights, different insights. Okay. And he was sitting. When I entered into his home, the home was full of god, goddesses, and a big statue of God. I won't tell you the name. It was a big statue. And this patient was sitting here. This is not the person. I don't want to taking the name of cancer, we get, terrified. So this is a patient sitting like this. And besides this seat, there was a big statue of God. Okay. So I got some idea. He's very religious. He's very religious. One thing was coming. He was religious. Same. What happened when I saw the reports? Oh my God. So I just asked for curiosity, do you know what is your problem? He said, yes, doctor, yesterday I went to a surgeon. He said, this is cancer and you need to get operated. So I don't want to get it operated. Do you know what will be the end result? Whatever may be the end result, it is good for me. How could you, again the same question, PQRS. What if a person suffers from these types of disease? He will go haywire from one doctor to another. And he was okay. See, doctor, pointing towards the statue of the god, which was exactly beside. My whole life is governed with this god. This God. And I believe that whatever happens, happens for the best. He has some plans. I have that confidence, doctor. I have that confidence that he will cure me in the form of your homeopathic medicines. And that was not flattery, my dear friends. Remember, this was not flattery. That genuineness, that honest, that purity was evident on his eyes. Okay, this God has sent you to cure me. And I was like, I was really, as Manish said, na, ki sometimes you fail, you treat hundreds of cancer cases and sometimes you do blunder in cold and corizas. So I was really very, such a, I was like, oh my God. But one thing again came in my mind. Be unprejudiced. Okay. Following messages of God, okay, having that strong confidence in God. Now imagine yourself, if you suffer from a small urine infection or a urine stone, will you say, Arey, I have confidence in God? Yes, of course, God is there, God is with us, God helps us. But how much of the population in the world can claim that, yes, whatever happens, now he's on the deathbed, he's about to survive or die. This is the condition. 87 years old man. And he says, coolly and calmly, I have full confidence in my God that I'll be all right because he's with me. Till now, everything he has governed, and now again, I know he will be curing me with the help of your medicines. Are you getting my point? Isn't it very, very peculiar again? So much of confidence at the deathbed. See the follow-up. I gave him now here I gave him n number of doses, but I will just show you the cases. This was a case. After 1 week, believe me, I'll show you if at all. I'll show the case. This was the first follow-up within 7 to 8 day. Dr. Lakshmi Khoth was with me. She will tell you if at all you don't believe me. And this, after 2 weeks, and this, see this. See this, and now compare this. And homeopathy is a science, an art, everything. My dear friends, believe me. And the rubric was simple. Again, we have a rubric: mind, thoughts, God, about confidence in God. Means what? Thoughts about confidence in God. We have only single remedy. Second remedy rubric is delusion. He is in communication with God. How do you claim that a cancer case will be cured with the help of God by your medicines? Directly communication. Now don't go with Varatram album. Varatram album is very rude. Come. Doctor, sit. Hey, chai de, pani de. Varatram album is that rude, insolent. Varatram albums will communicate with God with that ego. And how this? Hello, doctor, please come. See the difference. The DD, what we call as the differential diagnosis of Monteria medigas. The remedy will, and one is hopeful of recovery. We have only 2 remedies in hopeful of recovery. One is olive sac and second is sanguinaria. The journey of sanguinaria is something different. That happened. Let's don't focus on sanguinaria. The first rubric is olive sac. And what is olive sac? Olive sac, the combination, just what Pradeep Gupta sir and Subhash Singh said, the synchronization, the journey of the remedy with respect to the patient, the synchronization is very important. The journey started from communication with God, confidence in God, and hence hopeful of recovery. And that is olive sac. And this 30 I had to give the patient every now and then repeatedly, because every time I used to call him, every time he used to tell me, God is with me, don't worry. He used to pacify me, don't worry, doctor, God is with me. So this rubric was somehow not getting broken down into pieces. So I just go on hammering this dose 1 hourly, 2 hours. Okay. So thank you. Any queries? Gaurang? Please, any queries you can just. Am I audible, visible, invisible? Hello? So this is how we understand homeopathy. So this man in the disease, the emotional part, the mind part of the repertories, I think is not that explored. We all together will join hands, start exploring this mind section of the repertory. It's really wonderful. I tell you, I claim that there are so many mind rubrics in this materia medica where we have, where we have n number of says of the patient, the versions of the patient, but we I have not explored that mind section of the repertory very well. So we'll join hands, Gaurang, and explore the mind section of the repertory so that more we could explore homeopathic mathematica as
God
physical.
willing. Absolutely, absolutely. So thank you so much. Your talk is always, as you know, you are the centerpiece of our webinar series. It's always. So before we go ahead, I want to ask you a few questions. Some questions which are there on the YouTube channel on the talk. One of the question is, so in your understanding, what is the way to understand a rubric? How to understand rubrics? Suppose someone wants to start studying rubrics. How does it do it conventionally? Not about any method or any. We are not talking.
Exactly.
But a homeopath, a student somewhere in India, somewhere in Europe wants to start studying repertory. What is the way, according to you? What would your advice be? कैसे शुरू करना है? How does he start? Maybe in English will be easier for others also to understand.
Basically, Gaurang, actually, now when you take a rubric, any given rubric, for example, any you take quiet wants to be or naked wants to be. I take a small rubric, naked wants to be. See, first of all, we need to correlate the word naked with the dictionary meaning. And as Rao sir used to tell, make a sentence of that word in your layman language. For example, you see, I am always naked in front of my friends. Means what? Now we understand naked means I am open with everyone, with not everyone, with my friends. Okay. Now what is want? Every word single. Gupta sir also says, every single word is very important, Gaurang. Wants means what? Naked. No, rubric is not only naked. Rubric is naked. Wants to be. Means wants is what? Now there is a need of time. Now I have to. There is no option. So doctors have actually, I have an extramarital affair, and physician and advocate, you cannot hide anything. So I need to open up myself. So I need to tell you this because this is the version. Got it? So want has equal meaning. Not only naked and want, both are equally important. Naked wants to be means now the need is there. I have to expose myself, my inner mind, my inner feelings. What I don't know. Actually, it is not right to express in front of everyone. Those are my private feelings. So I'm open. So basically, I think the words in the repertory should be, you use it in a layman term. Make sentences of that remedy, that cases. That words, naked, for a carried, hold is like this, and clinging is like this. In difference, hold is like means so I am the authority. So held being means what? I am giving everything to him, and carry means just half of my weight. I'll carry. You just carry. I'll come. So these are things which we need to understand and explore day to day life.
So beautiful, so beautiful. And some couple of more questions. Sir, what is your so basically there are students from different schools. What is your take on different repertories? Because see, there are different repertories in homeopathy. There is Boenninghausen, there is Kent, there is Fataks also. There is Nair repertory. There is, and definitely we have complete repertory. That is a recent. But what is your take about old and conventional repertories, forgotten repertories?
So
what is your take on it?
See, basically repertories. Okay, what I would like to say in front of so many doctors, this conventional repertories have done their immense work and they have contributed like anything. Absolutely. Okay. And we have learned through this since our child. I'm practicing for last 24 years. So last 24 years, we are referring Pathaks, we are referring Boenninghausen, Farringtons, and every book was beautiful and is beautiful, of course. But what happens in this recent times, we now there are so many people who are working on proving and reproving. Now, podophyllum is such a wonderful remedy. See, podophyllum used to only understand 5 P's of podophyllum: the physical symptoms, prindlessness, protrudeness, prolacting, and prolapse, everything. But have we, because of these recent provings, podophyllum is now painlessness. The painlessness is just very close to opium. Harmony desires. He doesn't want that harmony. He doesn't want that, chorus. So these are some rubrics which we need to explore again and again. We need to reprove the remedies again and again. So see now hydrastis. I just take 1 minute. Hydrastis cannot. We are so beautiful remedy for stomach cancer. Beautifully we have. But I'll tell you, there is one rubric in repertory. I think it's in Fatah's repertory or Kent's repertory. When you are offered food, he just
throws away to the nurse and to the doctors also.
I had a case like this, and believe me, I have wonderful results. So whenever that's what the sir said, the synchronization with the physical symptoms as well as this emotional quotient of the remedy, then it becomes so beautiful to understand. And lastly, the repertories. Every repertory has its own strength. So I'm very glad to know that you have imbibed so many repertories together. Yes, every single repertory is very important.
Thank you so much. And finally, I don't know if you realize this, but you are the first person to get, actually not first, you're the second person to get my printed copy, just the printed copy of the book, because I couldn't. So you're the second person. The first person is my first mentor, that is Dr. Sankaran, and the other books I have already sent it to LM Khan sir and Subhas Singh sir. So you are the third or the fourth. So what is your first hand, bolte hain na, what is your first review of the book? What do you feel when you went through it? What is your thought?
Frankly speaking, Gaurang, yesterday afternoon I got the book in my hand and I was just going on with the pages. And the best part is you have taken the pages of the repertory chart and you are explaining something. That is something which was, I have not gone through it yet, but yes, definitely it would be a very worthwhile read to go with this.
And last question for you today. What is the secret? What is the secret of your enthusiasm, passion, and joy? How do you remain so passionate and enthusiastic?
First of all, see this. My wife always making me treats, all types of foods, and I'm like this happy. And this is my gang. She's Anaga Mahajan, my better half, like this.
Pleasure to meet you, man.
SKD, 3 nice men.
Hello. Pleasure to see all of you there. Pleasure to see all of you.
See, the basic mantra is loving, sharing. Okay? And just be with our friends and our loved ones. Bas, everything will come to place. Everything will come to place. Acha, Gaurang, I would like, can I tell you something about the... See, 3 Nice Men has a YouTube homeopathy channel. If at all anybody wants to, you can just ask them to subscribe 3 Nice Men in India.
Sure, tell about the channel. Sure,
3 Nice Men. They are exploring homeopathy in Hindi. Exploring homeopathy in Hindi, only in India. And one nice man, Moiresh Mahajan, homeopathy.
Okay.
I'm trying. I'm not.
What does this concept mean? 3 nice men means basically what's the idea there?
Basically, what happens is, Gaurang, actually, we in homeopathy, we feel in HHF, we feel that togetherness is very important. And I love you for that because you always make people together. It is three nice. It's three nice. Have you ever seen a stage where 3-4 people start speaking together?
It is just like coffee with Karan you have seen. Means
Yeah.
three people, myself, Dr. Shri Krishna Dafle and Dr. Alok. We three of together sit on and we talk on a remedy, and that would be just a gupshup on the coffee,
Great.
where we discuss our cases, we discuss rubrics, and that makes very it very interesting. Something
Lot
like
of
that.
fun. Lot of fun.
Yeah.
I think I remember Dr. Mayuresh Mahajan and the entire team. Your sessions are full of fun. I remember it. I'll not forget it.
Yes, yes. Chalo.
Perfect. So thank you so much, Dr. Mayuresh, and your entire group of family and team for coming today.
Thank
and
you. Thank
it's a
you.
pleasure to have you. It's a pleasure to have you, and I hope that we can collaborate further in future
Yes,
also.
yes,
I have
definitely,
a lot of-
definitely. We need to do work together, Gaurang. There are so many
Absolutely.
things to do. Okay.
Absolutely. Thank you so much. And
Bye. Bye. Take care, my new friends, old friends, all my respected teachers and legends. Thank you all. Love you all.
thank you. Thank you.
Put it.
Okay, so here we had Dr. Mayuresh Mahajan, who gave us such a brilliant talk, isn't it, about his approach, about his cases, and how he analyzes his cases. It was so beautiful. Dr. Yash, who's next? I think I'm only next.
Yes, sir. You are only the next speaker.
Okay. My God, I think we are going a little short on time, so I'm going to. Can you see my screen?
Yes, sir. We can see your screen.
Okay, perfect. Okay, so yeah, I'm a little short on time, so I'm going to finish my talk in less than 20 minutes, and then we are going to have the talk by legendary Dr. L.M. Khan sir. So, welcome to today's talk. We'll talk about art of repertorization, and I'm going to show you 2 or 3 interesting cases, and hopefully, towards the end of that, you can understand a little bit about my approach and how to do it. So let's see the first case for today. This is a case of a 30-year-old woman from Mumbai who had a very interestingly this case I had seen during the COVID times, and I'm going to show you the case, and I want your analysis. How are you thinking about this case? Okay, so we'll have a little bit of an interaction. So 30-year-old woman presented with recurrent tonsillitis, low-grade fever, um, temperature going around 100 degree, feverishness, and especially during the feverishness, typically she would get fever only at 2 o'clock. Every time the fever would come at 2 o'clock, and it will remain till bedtime, and there would be a lot of internal heat, and typically a lot of heat around the eyes and around the chest region. Fever here, it would be a typically only heat stage would be prominent. Thirstless during fever, lower back pain, leg ache, and pain in the hips, aggravated squatting. Let's see more symptoms in the case. I want you to analyze this case, so please listen to this case carefully. Tonsils, problems with the tonsil, alternating side, aggravated at 2 p.m., and aggravated empty swallowing, lot of body ache, aggravated by weather change, summer to cloudy weather. The patient had taken many homeopathic medicines without much change. A lot of craving for spices and salt, and prefers cold room, a closed room without fan. Typically, very chilly patient. Emotionally, someone who's mentally very timid and lack of confidence. Someone who's very scared of ghosts, insects, dogs, drowning, almost of everything in that way. Dreams that lions will come and attack her. This is another very important dream that she gets. And constant fever. The fever is just not coming down, almost for more than a month. Suspecting of COVID, suspecting of other illnesses, done all tests, still normal, not getting better. How do we analyze this case? Any thoughts? So maybe I can take some of your suggestions. Any suggestions for the remedy here? Anyone? Pyrogen, interesting, Dr. Shivam, because pyrogen was already taken by the patient. What remedy will you think? Let's take some thoughts here. Pulsatilla, interesting, but pulsatilla always very very thirstless. Yes, Hipar interesting, but Hipar so chilly that they feel better by warmth. Getting fever at 2 a.m. is the main rubric. Okay, something more. So I want to tell you now in this case, and some more suggestions. Gelsemium here. Okay, any other? So I want to tell you now in this case, as you see, for me the most peculiar thing is that the fever begins at 2 o'clock and the throat pain begins at 2 o'clock. So this is like an exact periodicity. Now when I see such peculiar symptom, one of my favorite repertories to start with is Fatak repertory. This is a repertory when you see something very very peculiar, something very singular and peculiar, then one of the best repertories is Fatak repertory. And the rubric that I have taken is, let's see here, periodicity exact. That's the first rubric I'll look at. Now why this is interesting is because see, in periodicity exact in Fatak repertory, there are about 6 remedies, out of which Arania, diadema, tarantula, spiders. Now for it to be a spider, there has to be restlessness. This patient is not restless at all. The other thought is China sulf nitramur. The patient has already taken China sulf nitramur and arsenic. So the only remedy that remains is Cedron, which is so interesting. And when I look at all the rubrics from Fatak, and there are some very interesting rubrics that I've taken, let's have a look here. And I've taken the rubric periodicity exact from Fatak repertory, eyes burning, and fever ache. And when I take that, the only remedy that comes through is Cedron. So interesting. Are you all with me? Have a look. So if I take this, and if I take eyes, yeah, you can see here eyes over and eyes burning heat, especially fiery. And if I just take these rubrics, that's it, no other rubric. See how artistic Fatak is. You have seen many things, but look at the artisticness of Fatak, and you will see a single remedy, Cedron. You can see this, how I have analyzed from Fatak. This is the art of repertorization, my dear friends. This is the art of repertorization. No story, no theory. In some cases, you have to just artistically find out the rubrics and look at the remedy. So interesting, isn't it? And I have given Cedron. Now, there's a lot of interesting thing in Cedron. Fatak writes, its exact periodicity is the main thing, interestingly. And a few more things I want to tell you about Cedron. Cedron is basically has symptoms like arsenic alb plus exact periodicity, and always better by warmth. When you see these symptoms, this is symptoms for Cedron. So Riaz Gajjar says, why not fever at 2 a.m.? Because the fever also starts exactly at 2. The throat pain also starts exactly at 2. So this, the commonality is exact periodicity because both starts at 2, isn't it? So that's what I gave. I gave Cedron 200 2 times a day for 2 days, and just with 2 doses, remarkable change. A fever which was continuing for 5 days just went away totally. With no time. This is the beauty of finding the exact remedy, and this is the beauty of finding the remedy for the patient. Let's go ahead. Maybe I'll show you 2 or 3 more cases before we finish for today, and we invite Dr. L.M. Khan. The another case is a case of acute viral disease. Now let's see what are the symptoms here. This is a case of a 33-year-old woman who presented with coryzine fever, with thin watery discharge coming very easily from the nose, fever where heat followed by chill, heat on the hands and face and chills on the leg. See, when patient gives these symptoms, you have to note down these peculiarities. Okay. Chills on the leg. During heat, there is a throbbing headache, which is better by lying down with closed eyes and sleeping. Lot of breathlessness, aggravated 3 a.m., better by beginning to walk, and breathlessness aggravated sitting and lying on sides. Bitter taste, loss of smell, desire for spicy food, and very thirstless. Very anxious as well. So when someone gives this kind of symptomatology, you have to analyze the case. And when I see fever cases, the repertory I use generally is the Boger-Bonninghausen repertory. And I just took exact symptomatology from the Boger-Bonninghausen repertory. And if you see that, you can see the rubrics. Fever compound begins with heat, then chill. Fever partial heat face off. Partial heat upper extremities, hands. Concomitant pain with congestion. A taste bitter. Walking ameliorate, taste bitter, and coryza fluent. So the only remedy that comes through is the remedy sepia, which is a very interesting remedy for fever, very lesser known. Remember, CPR should be given in complicated cases of fever. So CPR 200, just 6 hourly, and within 24 hours, the fever, and this is a COVID case we are talking about, the intensity of heat, chills lessened, the bitter taste went away. At the end of third day, no headaches, and breathlessness improved by 60%, and no headaches at all, breathlessness, etc. improved beautifully. So interesting. Let's come to the next and the last case for today. It's a very quick case. It's a case of an 82-year-old male, and I'm going to show you just one picture. When you see these symptoms, when you see this kind of picture, what remedy comes to your mind? Just based on that, I had to prescribe. This is a case of a ulcer. You can see. You can see here ulcer on the hand here, and typically this started after a kind of scratch, and there was a lot of bleeding and abscess formation, and abscess was getting bigger and bigger, and there was bursting in that, and it continued, kind of sticky kind of suppuration continued. Many remedies were taken, but there was a dark red color punched out ulcer you could see on the hand with irregular margin. The base was very red in color, very warm, hammering kind of pain, yes, and draft of air is what generally aggravates it. Concomitant lot of sticky phlegm from the throat, and state of mind very very hurried, wants to get better constantly, and generally has a lot of craving for pickles, okay, and has many other cravings as well. So based on that, I just looked at what are the main rubrics, and I used Fatak repertory for this. So you can see first case I used Fatak, just based on peculiarities, then I used Boger-Bonninghausen, and then I used Fatak again. Now in this case there's a direct rubric, and I want to show you how beautiful Fatak repertory is. Have a look. So you can look at the rubric ulcer, you can see, and you can type. And you can see ulcers round punched out, and you can see there are only 3 remedies there: mercury, phytolacca, calibi. Mercury syphilitic remedy, always remember, night aggravation. Phytolacca, vegetable mercury, again night aggravation. So the only remedy that remains is the remedy calibichromicum, and calibichromicum, and you can see the concomitant of a sticky expectoration. So calibichromicum, with the help of calibichromicum, 30, you can see in 5 days only the wound healing started, you can see here, and at the end of 15 days the pains, the redness, the cough improved, you can see, and further by end of 20 days further the redness and the cough improved. Finally at the end of a month, just exact symptomatology, and you can see the ulcer totally vanished. So there are different approaches. You saw another case of anholinum there, but it was different type of case. In this case, in that case, there were mind symptoms. The place where I was treating, there were not mind symptoms. It was based on physical peculiarities. So that is the art. That is the art portion in homeopathy. So I'm very excited to share with you about this art. And what is the art? The art is of repertorization. This is the secret of homeopathy. Repertorization, nothing more. And it gives me a lot of pleasure today to tell you something very exciting that we are doing here. Is that my new book, Art of Repertorization, is launched now, and this is the copy of it. I hope you can see this book. It's a book where I put my heart and soul into. It's a book where it's almost more than 550 pages, where I've spoken about different types of repertory: Kent, Fatak, Nair, Boger Boenninghausen, Boger Synoptic Key. There are more than 20 co-authors. There are many cases of mine. There are many cases of other masters, like other teachers all across India and Europe. So there is a foreword written by Dr. Sankaran also, and I have and in the end of the book there's something very special. There is a kind of case exercises towards the end of the book as well. So this is the book. You have all the contact details. You can write to Yash or Dr. Pratik. There is a 30% off for the first 200 books. Although the 200 books are already gone, so we are putting it for further 200. For next 200 again, there is a 30% off. So if you book the book, pre-book the book, you will get a 30% off. Book it as soon as possible. This is a book that every passionate homeopath, if you are passionate about homeopathy, you should be reading this book. You should be analyzing this book, and you should be going through this book. So I look forward to you reading and going through this book. That's all from me. It's a pleasure to have all of you today, and I think it would be great to have Dr. L.M. Khan here next on screen. Let's see if we can have him. Dr. Yash, we can invite Dr. L.M. Khan.
Sir, they haven't joined till now.
Okay, just see if you can connect to them and
Yes,
invite.
yes, sir. Yes, sir.
A little bit more about the book. I would like to tell you. The book I've been writing for a fairly long amount of time, but this is a book that also Dr. L.M. Khan has written a few notes about repertory in the book. Dr. Subhas Singh has written, Dr. Shorkar has written. But this book is something that I have been very passionate about writing, because wherever I went, people either used complete repertory or Kent or synthesis, and somehow I think we have forgotten the old classics like Boger Boenninghausen, Fatak, Nair repertory, Clark repertory, Roberts repertory, and we call it as the old and forgotten repertories, and we use it still, and there are very few homeopaths who use these different types of repertory till now. And the idea was that how to use those repertories in today's times, and that's why I wanted to bring it back to life and inspire some people, some of you, maybe some of you. And I want to tell you, this book is not for absolutely everyone. It is only for people who are very passionate and very serious about knowing repertories and learning how to use repertory. So if you're one of them, this would be the repertory that you should be using or understanding or applying for sure. Some more thoughts. So we are inviting Dr. L.M. Khan sir very soon to our talk to talk about his talk. How to procure the book? You can email. You can email. You can email on our email ID, Dr. Yash email ID or Dr. Pratik, and you can get hold of the book. Yeah. I think we are just about to have Dr. L.M. Khan. Yeah, let's have a look. It's a marathon masterclass. Today you heard great masters from different approaches together. Isn't that amazing? Yeah. So we are planning to do a lot of things. We are planning to launch a course. There is already a course on Nosodes and Sarcodes by me on my website. So if you are anywhere close to it, you can join our course Nosodes and Sarcodes, which is very interesting. Where I've spoken about different Sarcodes and different Nosodes as well. Dr. Yash, any luck you have been able to connect to Dr. L.M. Khan, sir?
Sir, they have joined, but some technical errors are there.
Okay. You're trying to connect them back?
Yes, sir. Yes, sir.
Some more questions. Maybe I can take some questions till that time. It's a Sunday evening, but the passion that all of you have to join and to learn is really something amazing that I can see by most of you. Also, about repertory, if you really want to understand the repertory, let me give you a little bit about some important themes about repertory that you should know. Let me give you a little idea. Yes, we can. Okay, I think we are lucky and we are able to join Dr. L.M. Khan, sir. Hello and welcome, sir. Can you hear us? We lost him again. Let's see if we can connect back to him. Yeah, some technical difficulties. We are just trying to connect back to Dr. L.M. Khan.
A time director. Thanks, Doctor. Yeah, I have opportunity to see this webinar of your young generations and the magical attitude as well as a command on the repertory. Just I see with Dr. Mahajan Sahab and your combination of these people for taking cases and utilize repertory. I think it is misused to ask me to speak. I have got very poor knowledge of repertory, not like Mahajan Sahab and you. They work very hard, and getting very good result with the cases. I am just going to discuss a case which was difficult. Difficult due to my own ignorance.
I like your humility a lot.
Not really. There are certain cases which is due to our own defect become a difficult cases. There are certain cases which is due to not
Dr. Yash, can you connect back to him?
Sir, they are online, but some technical error is happening. They are not able to join.
Okay, see now if you can talk to them. Okay, here we have. Yeah.
so lots of difficulties, making difficult patient. So the one thing which I like to discuss today, a case of
Let's try again. We are trying to connect back to Dr. L.M. Khan, so let us see.
and as per your request, discuss with the difficult cases. I found most of the difficult
We are trying to connect back to them. Let's have a look. Dr. Yash, any luck by connecting back to them?
No, sir.
Can you call them up and explain them how to do it?
Yes, sir.
We are trying our best to connect back to Dr. L.M. Khan, so just hold on for a few seconds. Let's see, we are trying again to connect back to Dr. L.M. Khan, sir.
माइक को ये लगाने से ऐसे Gaurang, I am
Yes, sir.
sorry for
No
this
problem.
difficulties
No problem.
which is not in my hand.
कोई दिक्कत नहीं सर.
I am
You please continue.
इसी का लगा इस पे लगा के देखो. I said one thing that my experience with the difficult cases. First important factor. Once I read a book of Berne Seigel, the man who well-known physician very good writer, and he wrote a book, Love, Medicine and Miracle. In his book, in the page 99, he discussed and said, homeopathically speaking, I can say that the cases are not incurable or curable. Rather, the cases is having a man who is incurable or curable. The person, the man who is going to be a curable, it is good to be treated by homeopathic medicine and cured. But the person, those who are incurable in nature, they are the difficult cases. And these difficult cases, very difficult to handle. For especially when you are going to taking a case perceiving, you need first to understand that is patient is curable or incurable. So the cases with incurability, the man who is incurable. तो यार जैसे रहने दे फिर सब उल्टा पुल्टा हो जाएगा. So in these cases, I need only palliations. I don't know what type of incurable or difficult cases you like to hear from me, but today I like to discuss a case with my fault, my ignorance, as well as case is going to be a very difficult one. A lady is about 35 or 38, like that, in between 35 and 38. Was a constant having is insomnia, sleeplessness. I have gone through the case, and the lady has got not getting very good result with my indicated remedy. I cannot say indicated, that it should be partially indicated due to my own fault, and I'm not going to recognize the case fully. The medicine, those who are related with the insomnia, is starting from carcinosin to coffea and some other medicine also. Not giving very good result. Not satisfactory, I can say. Then, especially, every time I try my level best to look after the case, but I failed. We learned first important factor, especially related to the women cases. There are lots of indication which they are going to not disclose due to the modesty. This is one of the very disappointing factor in our Indian culture. This insomnia, and the patient especially has got other important factor which I consider it, aversion for the sweets. This is one indication which helped me to reaching the remedy. But still मंजिल बहुत दूर है, तो repeated case taking. Once I asked about that why you are going to be suffering from this insomnia, is there any reason or not? She told me that no reason at all. I am a working lady and having only work to look after my computer seriously, and when I come back home, I enjoy with my children and husband. Then I go back to the past. Sometime in Indian culture, past is not going to be decoding perfectly due to again the question of the modesty. One thing she declared that she has got many times a recurrent attack of the amenorrhea. This was one important indication which I trace in this particular case of a lady who is always say that whenever I have got amenorrhea, I have a constant backache. No amenorrhea, no backache. If I started feeling of the back, means I am going to become amenorrhea. This is a very beautiful relation which I observed in the past, not the present. You know that the second one, the patient having a constant feeling when she is going to be amenorrhea, that just she is going to appear menses, a feeling of all sign, symptoms that patient having before appearing to menses. But menses did not appear. You people, a man from the repertory, you may try to search the remedy, which is also helpful to me. So these two important constant past, accorded past, capsulated past, which help me to reach to the constitution of the patient. And I make one framing of the question. This framing of question, sometime I used to ask. The beauty of this framing of question I learned from Dr. J.N. Kanjilal. Thanks to his noble soul. And she said, I have got prolapse, feeling of the prolapse, a very mild prolapse. And whenever I have got this prolapse sensation, a prolapse feeling, I got insomnia. Then I request her, why you not declare all these things? When I am questioning many related to your menstrual part, your private feelings, etc. She laughed over me and said that I think it is not important for your prescribing point of view. I said, ma'am, whenever you are going, on whatever maybe you are going to think that is useless for saying doctor, maybe for the allopathy, but a homeopathic,
Always remember, if your disclosure is very helpful to me. You know that I have got some very important keynote for prescribing in case of the insomnia and use of insomnia in many different cases. Among them is one of the remedy. So on that basis, I prescribe connecting past to the present. A symptom in the past having the same medicine, symptom in the present having the same medicine. So this is a connection, wanted connection, but think it is unwanted. Another thing that patient I call from the language of the physics, that interconnectedness and interdependentness. This is a physics physician, those who are enjoy the physics, especially the writings of the David Bohm. They can enjoy the beauty of homeopathic prescribing. In the prescribing interconnectedness, the past, that patient has got amenorrhea. And this amenorrhea, constantly feeling that patient is going to be appear. Symptom is menses is going to appear, menses is going to, but not appeared. Now I can tell you, my friend, you ask your many of young girls, those who are going to appear menses and having amenorrhea, backache. This going to appear menses and backache, amenorrhea, backache. This is going to be interconnected with the present condition of the insomnia, and the patient has got prolapse sensation of the uterus. This I can say this is due to my fault. The patient was not going to be response to my indicated remedy. Even I used coffee, no response. For this particular reason, I feel this difficult for me this case. Remember one thing, that for difficult cases, whatever may be the reason, either from physician side or maybe from the patient side, always search in the middle path. Don't miss yourself in the jungle of the symptom. I'm just avoiding to sharing this all jungle of symptom which she is going to describe for me, and I make in the trap of this jungle of the symptom. This beautiful understanding, interdependence and interconnected with the past and the present. The remedy was the same, and the medicine which I prescribed, senecio.
Yes.
Senecio I used, and after that, many times, and one of the wonderful successes which I feel whenever the patient has got amenorrhea, and the amenorrhea is going to be always constantly associated with patient feelings on that particular time. Every month, that patient is going to be appear menstruation. All the symptom, feeling of the appearing menstruation is one of the strongest indication among many medicines like Pasatilla, etc., etc. But amenorrhea with backache and these feelings of appearance, but did not appear. One more thing I like to add, that aversion for sweets. This combination, this syndrome of the senecio, in the present day, you will get many cases, in many cases, and many patients. So
There is
I
an
prescribe
interesting
200.
rubric in the repertory: sleeplessness in uterine symptoms, and the main remedy is senecio.
नहीं समझ में पूछो ठीक है.
So sleeplessness with uterine symptoms.
Sleeplessness, especially in a case of prolapse of the uterus, which is the very, I said that it is interdependent and interconnected.
Yes.
So whenever you have got amenorrhea with backache, as if going to appear, two. And the third, having a feeling and sensation of patient is going to be just appear symptom. Menses but did not appear. This is one syndrome. Is going to be dependent on another group of the symptom, the prolapse, sensation of the prolapse, insomnia. Ayusipia fail, cophia fail. With my all efforts, that is, for me, it is a difficult case. I just, when I am discussing with you, it is very simple and easy for you people. But in fact, I become shaky. I become very shaky that what to do. And many times I request her, please change your doctor, ask some other physician. But she insists, no, you have to give medicine. That is one of the faith. But these faithful conditions of a patient, my energy is going to become shaky. That's why when you said about difficult cases, at that time I make a plan to share something unique for prescribing point of view.
It's a beautiful
Failure
case.
as a physician to me, and modesty is one of the obstacle in making a totality of the symptom. These few indications which I share with you, and with all love and affection for you,
Thank you.
my
Thank you,
black
sir.
horse.
Black horse. You like to call me Black Horse.
God bless you and make a success. And
I've
give.
sent you my book as a gift even before
God
release.
bless you. God bless you. Very good. But send me.
Yes, I will send you.
I go through this book because the last which we have seen the script, that is very hodgepodge.
It is not final book. It was not a final book.
So you select cases.
Yes, sir.
In the repertorial analysis, two things I request you.
Sure.
And I request to all the physician who is going to associate it with you, please reason for the rubric selection, not random. Otherwise, young generation is going to be a defective generation. Reason, especially your decoding mental rubrics, where you say about that this is a main rubric, but I not used. I use instead of this rubric to that rubric. Reason behind it. Selection of rubric, reason, and strong reason. If your reason is pure, result is poor. Number two, when you select, you keep this in your mind that patient should be having the full feelings as well as of the symptom of this particular rubrics. Rubric, you know that is a simple materialized form of the symptoms, restricted form of the symptom. You disclose it, decode it. Young generation nowadays, in my experience, losing the thread of prescribing. They are going to claim credit on flattering himself. Okay, it is up to webinar is okay. But in practice life, you know that you need strong decision power. As you remember, I don't know, one of my case of nitric acid, where I prescribed for the rectal warts was removed, and that gentleman was homeopathic physician, expert from Australia, and having a master homeopath in this world. He was treated with this very pronounced homeopathic physician in the world who prescribed nitric acid. But change. The confidence and the command of the medicine is lost. When he came to me at that NIH. I have gone through the whole case, and the symptom is very similar to the nitric acid. I prescribed nitric acid. He laughed over me and said, so and so great physician prescribed nitric acid for me. Why you are going to give another nitric acid for me? Gaurang, I said that this nitric acid is mine nitric acid. It's bound to work. They are my servant. 3 months, no change. I always laugh. He's going to back to Australia. I said, if you like, you can take. Otherwise, my advice, you take only placebo. He just smiled and go back. After 2 months, he said, I have no rectal warts. My skin of the rectal area as if I born today. Confidence. This the beauty and art of the Calcutta School of Thoughts. When you prescribe, otherwise don't prescribe. If you prescribe, sit on the remedy.
Sit on the remedy.
Sit on the remedy. That is the demand of the presidency. Now, homeopathy is going to be under the file. You bring this homeopathy to the clinics, bedside. I bringing organon to the bedside. I bringing homeopathic materia medica to the bedside. I am bringing your art of selection repertory to the bedside. That's why I'm saying sometime that send me your books. I like your books.
I will send you.
That's why I'm saying, with my good efforts, love and affection for you and your team, your associates. Yes, Sony is very nice gentleman.
Yes.
Which I found with you. With my best regard to your webinar. Pardon me. Thank you.
Thank you so much, sir. Thank you. And we conclude our webinar for today. And we especially thank Dr. L.M. Khan to have joined us. One last question for you, sir. Before we finish, one last question. Especially for students, in your understanding, what is this? How should they start studying repertory? What is the secret of studying repertory?
Repertory.
Yes. How to start studying repertory in your understanding? What would be your message? Yes.
I'm going to discuss the secret because it is known to all of you. But ignorance is one of the prime crime for us. You go through the writings of Sir John Ware and Margaret Taylor. It's a small introduction. And this small introduction, he gave one italic letter. In any rich homeopath, rich means mentally rich, qualified, if they are going to say anything with the italic letter, starting from Honeyman to this Margaret Taylor and Sir John Ware, always give importance, always, brand importance. And he said, more than 3 places, if well marked. Rubric is going to be framed by the symptom is going to be well marked. Selection should be based of rubric for well marked symptom of the patient. You know, from aphorism 6 is going to be merged with the 7. 6 is portrait of the disease and the 7 is totality of the symptom. Please read again. And my webinar is going to be continued related with the organon. It's really beautiful. I am going to express myself that well-marked symptom is going to be considered for the totality. And if it is a question of well-marked, always few. not all. Majority is going to be in a minority. My symptom of selection is always in the minority, which an outcome of the majority. This minority symptom, if well marked, you prescribe. I simply say about this Senecio case, I know from the knowledge of Materia Medica that Senecio has got a wonderful combination and beautiful relation, insomnia with the not only prolapse, other menstrual problem, any menstrual problem, even up to the stage of climactic. Climactic stage, in my opinion, is one of the important features of a woman related to the menstrual. If the woman is going to become insomniac, sleeplessness, even in the later stage of life, means menopause, don't forget Senecio. With aversion for sweets. These are the few symptoms. Honeyman in many places in the organon is going to consider. Cipher the symptom, cipher the symptom, cipher the symptom, reduce the symptom, cut out the symptom, and reach to the well-marked symptom. Your selection of rubric is going to be, I'm also using repertory, but the question of only, that's why I said you, that when I'm going to say the case, please repertorize this and tell me what the remedy is going to be in the repertorial analysis. There are lots of cases, but whatever may be the condition, repertory is not going to disclose the remedy. This is what I learned with my very poor practice of life. But sometimes repertory is the only solution. Only solution. And for this reason, I will just request you to read Margaret Taylor and Sir John Byers' writing of repertorization. Keenly, I said not roughly speaking, or roughly reading, no, very minute. And note it, how many times they said, if well marked, in italic. And few, the same meaning, but not in the italic. Please go through your classes, your people near and dear to you, discuss about the well-marked symptom.
Absolutely.
Thank you.
Thank you so much, sir. And I will wait for the review of the book from you, which I send you.
This is for you. I am just going to share a seminar or webinar with you.
Okay.
It is only for you.
My God.
Only for you.
Pleasure.
Which I have got in my mind for your love and affection to me.
Sure, sir. Sure.
Your closeness to me. God bless you.
Thank you, sir. So thank you so much. Thank you so much, sir, for joining us. And we come to the end of the talk today. Dr. L.M. Khan has really taken this webinar to another level. And yeah, we come to the end of Super Sunday. And first of all, I want to thank Dr. Yash Soni. Thank you, Dr. Yash, for being the main person involved in the webinar. I think all of you should be thanking him because he's one of the main person because of which this entire webinar is planned. He has done all the background work. He's handling the technical team. He's our main producer and director of today's webinar. Thank you so much, Dr. Yash. And also, he's the main person of our, he's like the all-round of our team. So he's also, if you want to buy my books, Art of Repertorisation, you can write to Pratik also, or you can write to Dr. Yash also. This is the book. And all the books are going to get in our hands on Thursday, and then we will be sending it to all of you. So whoever would be interested, pre-booking offer is on. There is a 30% off. You can write to us, and Dr. Yash will handle everything. So thank you so much for today. Have an interesting week, and keep in touch. There's a lot of new things that's happening. Thank you.